for the fantastic participants and musical chairs making a swift move from the chamber to here. So yeah, welcome, sunny day, lovely sunny evening. So welcome to the Children and Young People Scrutiny Commission meeting for April. This is a formal meeting of Hackney Council and all the usual constitutional requirements of council meetings apply. Can I remind members and officers that this meeting is being held in public and is being broadcast live via the internet. The rights of the press and the public to record and film the meeting apply, and everyone present should note that media representatives may be in attendance, are in fact in attendance, or viewing on the live stream. Apologies for absence. So I've got apologies for the Group Director for Children and Families, Jackie Burke. Do you have any others?
Just Councillor Leela Dax-Scott and Salma Kantora.
Thank you. Apologies for lateness. So, and connecting virtually, we'll have Mayor Bramble. I don't think if there's anybody else. But also in terms of commission members, we've got Councillor Sizer, who's connecting virtually. Okay, item 2, there are no urgent items, so the order of business is as out. Declarations of interest. Do members have any declarations of interest? Joe.
Cool, Governor.
I'm saying it. Yeah. So long as we can hear each other in the chamber, we shouldn't need to use these. Yeah. Councillor Sizer.
Parent of special needs child.
Any other declarations?
I'm just going to go for would be down.
Thank you, Stephen. Okay, now moving on to our first substantive item of the evening, accessibility of CAMs in Hackney. In March 2022, the Commission assessed the accessibility of local CAMs through the Cabinet Q&A process. At this meeting, the Commission noted the acute pressures which services were under and had resulted in lengthy waiting times for children to be assessed and to receive therapeutic support. The Commission agreed to follow up this work in greater detail within the 2022-23 work programme. The Commission therefore requested an update from local CAMs on the accessibility of local services to include the details of this. The details of this are set out on page 9 of the report pack. To support the scrutiny of this item today, the Commission have also undertaken a number of site visits to a range of providers within the CAMs Alliance, including First Steps, Specialist CAMs and Off-Centre. The Commission also held a focus group where 8 members of the Commission were able to discuss service accessibility with a range of mental health practitioners from First Steps, Specialist CAMs and Off-Centre and wider CAMs Alliance. At the outset, we would like to thank services and practitioners who gave up their time to speak to us and for responding to all our questions. I would like to emphasise the importance of being able to talk to frontline practitioners in the scrutiny process, as this provides additional insight and helps members to connect with better understand the issues that we're talking about in the scrutiny meetings. It really is very valuable. So thank you, in particular, Sophie, for ushering us around to the different services. We really appreciate it. And it's also really helpful for us to speak to people on the ground about what they think might need to happen to improve things. So again, thank you all. So attending this evening, we have Nadia Sika, who's the Integrated Commissioning Transformation Programme Manager, that's a mouthful, for Children, Young People, Maternity and Families for City and Hackney Integrated Care Partnership. That's when I thought it'd finished. Then we've got Sophie McElroy, who's the Senior Programme Manager for City and Hackney Children and Young People's Emotional Health and Wellbeing Partnership, CAMS Alliance and Hackney Education, and Greg Condon, who is the Programme Manager for Mental Health and Care Board. We have around 50 to 60 minutes for this item, so can I ask officers to highlight key issues from the report? For no more than, I think we can say about 15 minutes? Just 15 minutes, and then we can go to a Q&A session with members. So over to you.
Thank you very much. Thanks a lot for having us. As you will have all had the pack. So what we'd like to do is just pick up a few highlights as the Chair has suggested, starting off with myself, Nadia Seeker, the Transformation Programme Manager. I'll talk us through a little bit around the local national context, which I know that the Commission is very familiar with because I know this item has been a number of times previously. But just in terms of recapping where we are and to highlight some changes that have happened since this item came last year. And then I'll hand over to Sophie for the rest of the presentation. So in terms of our sort of local and national context, the Commission will know that the emotional wellbeing and mental health of children in City in Hackney is a top priority for us locally at place level, and as it is for all of our partners across the integrated system. The national drive to prioritise emotional health and wellbeing and mental health of our children remains to be driven at a national level, and this is partly down to the 5-year forward view for mental health and the NHS long-term plan. Both those prioritise children and young people at place level and ensure that we're aspiring for parity of esteem and with physical health. The Commission will be aware that we are required locally to produce a publicly available CAMS transformation plan for children and young people. And that sets out how we intend to achieve the vision of all children and young people receiving the right support at the right time in the right place. Additionally, locally, our 0 to 25 City and Hackney Emotional Health and Wellbeing Partnership supports the delivery of both the transformation plan, but also our local integrated emotional health and wellbeing strategy for 0 to 25-year-olds, which Sophie will talk a bit more about in her segment. Post-COVID, the partnership continues to address my challenges around demand and capacity for our services. So COVID has brought about a surge in demand for services, as you know very well. And there are a number of work streams around how we're addressing that, including work around neurodevelopmental pathways and investment in surge response through our services locally. You'll be aware that last year in July, 7 CCGs in North East London merged, and that was a national level change. That's brought about the opportunity for us to take stock and rethink what we're doing locally. So it's been an opportunity for us to implement further transformation priorities. The transformation required, however, does necessitate that all partners and service users work closely together. And while COVID has been devastating for many, it has boosted integration, capability, opportunity and motivation, placing NEL partners in the right circumstances to embrace this change. As part of the structural change, the CAMS Alliance, a collaborative made up of local organisations delivering services to support and improve emotional wellbeing and mental health outcomes, has formally come together with a view to increasing integration of services at place level, and many representatives of the Alliance are here with us this evening. The Alliance has formalised responsibilities to work in partnership with one another, as well as wider partners from health, education and social care, to jointly deliver services, programmes and projects that align with our system priorities. And you'll hear more about those from Sophie. Within your pack, you do have 2 diagrams which set out governance around mental health. We have our CYPMF governance structure, as well as the wider NEL governance structure. If you have any questions on those, we'd be happy to take those when it comes to the Q&A section of our presentation. And I'd like to hand over to Sophie now.
Thanks, Nadia. Just to welcome our CAMS Alliance colleagues who've just joined us. Sorry we're late. Yeah. So I think one of the ways, I think, as Nadia highlighted there, where CAMS and society is facing huge numbers of challenges, not just because of the context of the world that we're living in around post-pandemic, but our children and young people are also facing significant challenges, which they bring with them, and on a good day, and this is the irony, on a good day we find out about them and we can intervene. And of course that might look like referrals into CAMS services, but at an earlier level and a point before the need for a clinical intervention, there are lots of different ways that we can address those needs. And so one of the sort of emphases of the Emotional Health and Wellbeing Partnership, which is linked and referenced in the briefing pack, is about broadening out that understanding of our responsibility as a community and as a society to understand children's well-being and to understand what children need in order to enjoy well-being, and to be able to pick up on difficulties when they emerge earlier rather than not picking up on them or not offering support at the right time from the right person in the right place, which then of course will lead on to a higher level of need and necessitate the need for referrals into CAMHS services. So the way that we're approaching these challenges is by looking at it hopefully as a system, and the emotional health and wellbeing strategy attempts to do just that, really, to recognise that CAMHS isn't the one and only answer to children's wellbeing and mental health. CAMHS is a generic name. It's not one service in City and Hackney. It is several services, which is also outlined in the pack. You can get the map of services. And I think Nadia's highlighted the fact that the pandemic has, you know, in a good way, has forced us to work in a more integrated way, because we've had to pull together, we've had to really think together as system partners. And the strategy is really all about making sure that we are organising ourselves in that way to continue. I mean, the strategy was written before the pandemic, actually, and then published during the pandemic, but actually it represents the move in the right direction where we're all thinking about that. And I like to draw an analogy between how we think about safeguarding, particularly in schools now, which is that it's everybody's business, and children's mental health and wellbeing is everybody's business. So we all need to be pulling together and working together around that. And with that in mind, the partnership, the Emotional Health and Wellbeing Partnership, has a series of whole system priorities, such as, for example, the CAMHS single point of access. This has been one of the, I mean, it's still in its early days. It was launched in November 2022, and I think it's safe to say, looking at my clinical colleagues, that we're already reaping the benefits of that system, which is streamlining the referrals process in the system, allowing us to gather data in a much more consolidated way and to be able to find the gaps and the potential weaknesses in the systems that we have. But more importantly, getting young people and children and families access to services more efficiently, more effectively, to the right service at the right time. So that's one of the whole system priorities, which has come very much from within the CAMHS Alliance and affects the CAMHS Alliance, but also improves the quality of services and experience of services for the whole community. Another whole system priority that we've taken in recent times is around eating disorders, where we saw, I think, a doubling or a tripling of referrals into eating disorder services.
Pandemic, doubling of referrals.
To the point at which the service, that particular part of the CAMHS service, wasn't able to keep up with its deadlines in terms of waiting times. But happily now, through really good partnership working, partly through the emotional health and wellbeing approach, but also through the services efforts itself, has now come back down to a manageable level, and I believe deadlines and waiting times are now being met. Other priorities for the whole system have been around crisis services, and ensuring that crisis services are being developed and enhanced, so that even though it's a relatively small number of young people that experience that high level of mental health crisis, that the services that we have are absolutely fit for purpose and can meet those young people's needs, again, in the right time, in the right place, from the right people. And then a piece of work that's just starting now is we're horribly conscious and aware of the waiting times and the processes around neurodevelopmental assessment. And that's something that's at the top of everybody's agenda within the partnership and within the CAMHS Alliance. And we're just starting a large piece of demand and capacity work to think about what our pathways are, to understand what the difficulties and the challenges are, and then to come up with some possible solutions to dealing with some of those blockages and those waiting times that young people and families are experiencing. So that's some of the whole system work that we're currently engaged in. We also are very keen on developing our prevention and early intervention work. So again, going back to that idea that I was talking about earlier on, where CAMHS, the responsibility doesn't lie entirely with CAMHS, that we have to have better capacity in our systems and our services to pick up on difficulties much earlier. So thinking about prevention and early intervention, we've got a number of initiatives underway. WAMS is perhaps one of the best known ones, WAMS, and that's Wellbeing and Mental Health in Schools, and also mental health support teams, which is that schools interface piece of work. The aim of WAMS is not child facing. The aim of WAMS is to upskill school practitioners to have much greater capacity, because schools are kind of primary care service. They spend up to 30 hours a week with young people, 5 days a week, 39 weeks of the year. And so what we're trying to do there is to upskill schools to be healthier places that are in a much better position to support young people in a universal way. So not just when things go wrong, but to create that healthier school. Also, in terms of prevention and early intervention, again, in schools, we're offering the Tree of Life intervention, which was an intervention that was developed in South Africa. And it's about developing young people's sense of who they are, identity, and building on strengths. So that's something that's universally available now through MHST and also through the Growing Minds project. So we've got a number of different approaches to this idea of all of us taking responsibility and developing capacity in the system. And then just moving on really to think about what's the model that we want to try and follow around this. And there's a system called iThrive, which we're just at the beginning of the journey with iThrive. It is a national initiative. There is an expectation for areas for place-based partnerships to develop this iThrive system and model. And if you look in your packs, you'll see how we've mapped the services against differing levels of need, from very early universal right up to that crisis and inpatient admission situation. So we think this is the model that we'd like to pursue, and we're just getting started on that work now. And the aim of the game is to make sure there are no gaps. So we identify where there might be shortfalls, there might be gaps, and we're making sure that we are covering those gaps earlier on. So we're shifting the demands and the sort of the concentration of resources and to that earlier point, not only so that we can save the more specialist services from being overwhelmed, but also so that children and families have a better experience of their lives and enjoy better well-being. I'm not going to speak to the data because that goes into a lot of detail, but very happy to come and take questions. And again, our colleagues from our services are here and can speak to their own individual service areas if that's helpful. And really, just wanted to spotlight that although none of our services is perfect and our local area is not perfect, we have actually recently been recognised in City and Hackney for in the Children's Commissioner's Report of 2022 into mental health, which recognised City and Hackney CAMHS as being the sixth best, for want of a better way of putting it, in England. So I think that's worth celebrating and flagging up. And it's across 5 different metrics that decision and that sort of judgment was made, which I think says quite a lot. So that's the presentation, unless anybody wanted to add anything to what I've said.
Thank you very much. So I think over to the Commission for questions. Councillor Suso-Runga.
Thank you. Sophie, I think I could ask you, because I think this came in your section. Can I ask you a little bit about the refreshed action plan that you spoke of? What's been added? What's changed? Any feedback on the benefits, in particular around consolidated data, that you would like to expand a little bit on those 2 sections?
Can I just clarify with you this is a lot of action plans in the system.
You mentioned a refreshed action plan.
For the Emotional Health and Wellbeing Partnership.
Yes.
Sorry, apologies. So that work is just starting. We're actually in the process of trying to recruit a clinical lead who will lead on the Emotional Health and Wellbeing Partnership. So that's yet to be determined. But the action plan was sort of put down at the time that the strategy was published, and as we know, actions don't stay static for very long, so the whole thing needs an overhaul and we need to reset those actions.
I look forward to the refreshed action plan. When do you think that might be available, or are you not able to say at the moment?
As I say, we're in a process of trying to recruit a clinical lead,
Right.
but initially we'd hoped September. It might be a little bit later than that.
And obviously recruitment is key. And I think that's something that we might talk about a little bit later as well. So thank you.
Councillor Turbot-Deloff, if you don't mind, if we take a couple of questions at a time, that might be to get your pens ready, just in case. Councillor Tebbit-Deloff and Joe with.
Thank you. Thank you very much. This report has been really interesting to read. It seems that the Alliance is bringing some very good, efficient mapping for access and support. Myself, I'm a mental health therapist and mental health champion for Hackney. Was quite impressed with the mapping that you did of the steps. Very, very impressed with that. And also really good to hear as well that you have received the recognition of the Children's Commissioner, which is quite important. I do have a particular interest for us as a council to understand data around children and young people presenting A&E, especially around crisis, because we do know that my understanding of the increase in camps and young people's need for mental health has been immense across the country, not just in Hackney. So what I think is important for us to understand is why are young people presenting to A&E? According to your report, it says on page 19 that within your system priorities, you hope to reduce the number of young people attending or presenting themselves to A&E that do not require medical treatment. So it seems that you spotted or you identified that you do not need that, but they're making their way. And that's a trend that's been happening for a few years. So young people that are not accessing support, that they're making their way to A&E as an emergency, right? So can we know the number of young people attending in Hackney, attending A&E? Do we know why they're making their way there? What are the the trends, emerging trends are happening for them? And what percentage of those follow medical treatment or not? What alternative? There's a few questions in there. Thank you.
So I'm going to actually hand over to my colleagues from Specialist CAMS, under whom the crisis service sits. Over to Lindsay.
Yeah, so is there data in the packs around acute?
I haven't got crisis data in this pack.
No, yeah, we don't.
But we can get it for you quite easily.
Yeah, we can.
Very, very well.
I mean, I can start, and then we can also kind of share some of our thoughts as well. So, yeah, there has been an increase in presentations to crisis. That's why we've expanded some of our crisis services, particularly our nurses sitting within A&E and supporting a diversion away from A&E if possible. But also liaising with our paediatric colleagues if it is apparent once there's been an assessment that actually their needs aren't requiring them to be admitted into hospital, and actually they could be supported at the community. Some of those numbers, though, are reflecting some of the system challenges we have around coordinating, making sure that it's safe to discharge, and that's working alongside colleagues with the social care. And we've seen some of those delays due to the numbers of young people that are presenting at any one time, the availability of placements, and also sometimes the complexity of need that a young person is presenting with at that time. So we can certainly provide some data around that. But the establishment of the team kind of reflects us recognising the need and very much hoping to make sure that a young person isn't in an environment like A&E for any longer than they need to be.
I think Councillor Gordon's got a follow-up question. I don't know if yours.
Yeah, and I think this is. Yeah, I mean, I'm really pleased, obviously, to hear you say that, because I think we probably all agree that we don't want young people in mental health crisis in A&E. But I just wonder whether that data would also include analysis of whether those young people have previously made an approach to part of your services or been referred anywhere, because I think it would be really interesting to see that, what the previous history of these young people whose cases have escalated to an A&E.
Yeah, repeat presentations and whether they're already known to CAMS,
yeah,
something that we talk about. I mean, I can reflect from an operational basis that we met in COVID 3 times a week to together as a group about the number of young people who were at A&E presenting with the information of whether they'd accessed our services before, whether they'd accessed our services or presented at A&E within a certain time period, and kind of what we needed to do to support them to return home, or whether we needed to consider if it was appropriate for them to be admitted into an inpatient unit. So we do have some of that data. You are able to, with patient identifiable data, to kind of work out whether some of those are repeat presentations or not. So yeah, we can share that afterwards.
Thank you.
And I suppose the hope is that those presentations are going to go down with, you know, I Thrive and the single point of access, and it being a lot clearer and easier for people to access services earlier on. So presumably that will be something that will be looked at going forward, whether to sort of assess the efficacy of, you know, the introduction of new approaches and streams.
Yeah, we're working with there's two spaces where you could see young people kind of being diverted away from crisis and being kind of cared for at home. First is admission into Tier 4 units or mental health units, and ELFT is part of a collaborative of organisations that has been reviewing that information since October 2020. Yeah, I'm forgetting my years, and they've got some data which is really helpfully showing how we're making an impact there and reducing the need for young people to be admitted. But I think you'd also be able to have a look at attendances at A&E. I mean, there's a piece of work that the Alliance is considering. We've met together as a group to think about crisis, to think about where there are points within our pathways and our systems where we could intervene at an earlier stage with young people, and hopefully support them to a point where there isn't a need for them to present at A&E. One of the services as well that we've kind of just started to develop within City and Hackney is the not to annoy people with lots of acronyms, but ICCS. So it's the Intensive CAMHS Crisis Service. And this is a service which will very much look at diverting more people away from being admitted, being kept as much as possible within their communities, close to their families, as much as possible remaining within schools, but still receiving the level of intensive support that they might have needed to go to an inpatient unit for. So we should be seeing, with the development of the service, a really clear diversion of young people away from those spaces to be held within that service. And we'll be able to update around the kind of the way in which that's working over the next year.
Yeah, I'm so sorry. I mean, some young people sadly will require admission. Are you confident that we have sufficient capacity for all young people who are in that situation?
Yeah, I mean, the Coven, which is the inpatient unit that ELF runs, who is in a collaborative with other inpatient units, and they have experienced some challenges in COVID, but they have mainly been able to admit and keep young people within North East London. Their collaborative are showing that they're not having to send as many young people out of area because they have enough capacity within North East London to be able to support them as close to home as possible. And they've done a lot of work as well around lengths of stay and ensuring that young people aren't in an environment such as an inpatient unit for any longer than necessary. One, because it's a restrictive environment and you want to reduce the amount of time that a young person has to spend there, but also to ensure that there's the availability for young people who need that level of support as much as possible.
It's all right to just add something that in community CAMHS, Vicky and I jointly lead community CAMHS Homerton with Susan Crocker, who some of you met last time. But we've also, she might probably talked about the development of the Tier 3.5 pathway to help for children with disabilities as well, and complex needs, with the whole intention of keeping them out of hospital. And it's often children who haven't been able to access education, or they're at risk of placement breakdown, with intensive support through home-based teams, and that's had some really good results actually. But it's a small resource of about the equivalent of about 3.5 clinicians working across the borough, but because a lot of the children and young people who end up in A&E, as you'll know, are children with complex disabilities and neurodiversity, which also requires understanding.
Thank you very much for that. I think Jo had a question.
Actually, my question was regarding what proportion of people that are turning up in A&E or in crisis who have maybe as yet undiagnosed neurodiversity, I know we've got these sort of huge waiting lists on the sort of ND sort of pathways and systems, but how many of those children are presenting in crisis through other areas of CAMS and before they come onto the ND pathway? I guess, so that was the first part of that question. And also, I think there's something really complex, isn't there, around the intersectionality of sort of ND pathways, self-harm, eating disorders, gender dysphoria, and I know that's complicated, but is that part of all the review process that's going on as to how to sort of, that single point of access, how are you capturing those people early on in those pathways?
It's such a good question with so many layers to it, I think. And the single point of access, just to be clear, is the triage centre of the CAMS services. So it's the first point of call that connects all our different services, not an intervention branch in it. It's triaging to then refer onto the different pathways. But what we do, and I don't know what the actual data is because it's hard to capture the data of what's undiagnosed neurodiversity, but what we do know is particularly in adolescence and late adolescence, and especially in girls, there's a higher incidence of self-harm and gender questioning, gender dysphoria, gender identity challenges. There are quite significant numbers of neurodiversity because we've changed our assessment and clinical processes in diagnosing particular autism in girls. So that's a big part of it. And then you see through the trauma of the anxiety in which living the world, certainly post-COVID, has led to more self-harm in that population and disorders. So there's a huge overlap, and the challenge for us as clinicians in the diagnosis side of things is disentangling trauma from neurodiversity, because they clinically present, they look the same, and often it's both. So but I think it's unusual, I don't know, but I think it's unusual for people to turn up in A&E not to have had any contact with services, because often they've been picked up at school, or children who are not attending school, school's overwhelming. But the kind of population you're talking about, absolutely on everyone's mind as being, central to what we need to think about. And
I don't know if I'm allowed a follow-up question, but on the point about children not in school,
yes.
I guess we know that there's a growing number of those children who are struggling to a greater or lesser degree, who are either out of school completely, or who are only in school 50% of the time, or who are in school but not actually in a classroom because they're so overwhelmed by the classrooms. And what is being done at the moment as a borough, and obviously that
perhaps I should say something about that. Roger Davis, Secretary of Therapy at Specialist CAMS in Elf. We did an audit of this quite recently. About a quarter of our caseload fit into that category in Specialist CAMS.
A quarter of the whole caseload in Specialist CAMS.
Yeah, across all the pathways.
I have children who are not at school.
They're our bread and butter in case, I'm afraid. So yes, it's a huge issue, and just to add to what Vicky has been saying, I think intersectionality is the norm. This is what we deal with. It's certainly in specialist CAMS. No one comes to us with one problem. It just doesn't work like that. Everybody comes with multiple problems, and it's really untangling that and working out how it works, and is a lot of the work, I think, for a treatment.
And also, just to add what's been, I think it's such a good question. What are we doing about this, and at what level? So at what level can you intervene? And I was just thinking this morning, I was in a workshop which was supposed to be an early intervention waitlist initiative for families who have been referred in the last 3 months. We don't want to wait 6 months to be seen. So it was literally one of 2 workshops, and of the 8 parents in the room, 6 of them were talking about children that sounded like emerging neurodiversity, children who were struggling with anxiety post-pandemic, struggling with peer relationships. So in terms of what we're doing, it's such a good question, because I think we need to intervene early, quickly, think about the anxiety. It's been absolutely overwhelming for teachers, manage, and for parents to get children at school post-pandemic. So I think we've been doing quite a lot of anxiety workshops, early intervention around anxiety, even whether it's or not it's neurodiversity. When it is, it's the anxiety which is really challenging for the children. So how do we intervene in that way? So I think we have to, and then working with our colleagues in schools, MHSTs, thinking about skilling up teachers. But once the child starts on the trajectory of missing school, it's very, very difficult for the families to get them back in. So just trying to offer interventions and prioritise children particularly. So obviously we have got waiting lists, but when children are starting to miss school, we prioritise those children in the same ways we would with self-harm or suicidality.
So as a result of the audit, there is a strategy in place which is prioritising those children to try and get those earlier interventions.
Yes, well, I think it's part of the Thrive, isn't it? I think, sorry.
Yeah, always prioritise.
Yes.
Staff.
Yeah.
Just in terms of one of those indicators that actually clinically, if you try to intervene early before those terms of not attending school starts to develop, it's much easier.
Much easier to fix it in the first few
Very
months
difficult
after
once
that it gets
patterns
greater.
are established.
Yeah, I mean, just to say, I mean, this has been a multi-agency audit. We've been working with education psychology and all the early health services within the borough to really try and connect up what we, because the solution to this isn't going to come from one service. It is about how we coordinate our work.
And how confident are we that the right therapies are available for dealing with this? For example, I mean, is it 6 weeks of CBT? When actually something a bit more ongoing is what's necessary?
There isn't a right therapy for school refusal or non-attendance in school because you really need to understand why they're not going to school, and reasons for non-attendance are multiple. So I don't know what the right therapy is. I know we need a range of therapies available. That comes from a good formulation of what the problem is in this particular child, in this particular family, in this particular school.
I guess more broadly in that case, are we confident that we have the right range of therapies and therapists offering those therapies? Is there enough longer term therapy available as opposed to lots of very short term therapeutic?
I think the answer to that is no. I think I think we are in our service, which is the early intervention bit, we're funded to offer 6 sessions and then we have to close. So we have to think really carefully. One of those is the assessment and formulation and thinking with the family and liaising with the school and liaising. So it often isn't enough. So you do the best that you can, but we feel constantly like we are just about giving a bit of a flavour to a family of a relationship that might be supportive for a bit, trying to skill up with the teachers. We do our best with parent interventions. We try and group parents together, but I think it's so much of this is relational, and families who are isolated feel shame, feel disconnected. To be able to offer something longer term and to support attachments which have been complex, I think we haven't got enough in the system access to long term or family therapy, or no, we're not resourced like that, I don't think. But we do the best that we can within the model, and I think I was thinking about what you were saying about Thrive as well, Sophie, that it's a framework that fits for us as a borough because it sort of fits with, as you were saying, Beth, doing community work that's place-based, reaching people, working through staff, skilling up parents, skilling up families, and then protecting specialist services and tier 4 for the children that need it most. But yeah.
Can I just add also that I think that the only way you can do that work is in partnership with teachers
Yes.
and colleagues. So actually when we're talking about the kind of intervention we're doing, the only way we can do it is through the WAMS model. So actually now we've got some workers in schools to link people with, or I've never been able to work with family in that situation without involving colleagues from sexual organisations, family friends, an auntie, a grandmother, an imam, a rabbi. That's the way that you get children back into the school systems with broader community support, not individually as a clinician.
So we need more workers who can actually do direct clinical work in schools.
Well,
no.
You see, I mean, I think we have to be really careful about this. There's an early intervention preventative piece of work. It doesn't require high levels of skill or lots of therapy or any lengthy intervention. It means noticing, acting quickly when the kid is starting to miss a bit of school and dealing with it in a trauma-informed, therapeutically informed way, so it doesn't become a chronic problem. We really need to stop these things becoming chronic problems. That's the key, because if you get to the stage where they're coming to specialist CAMs and they are in need of long-term therapy, you are going to get them back to school maybe 25% of the time you might succeed. And that's the real, let's be realistic about what good therapy can achieve. It doesn't fix everyone. It doesn't even fix the majority. It's much more important to stop them falling out of school in the first place. Do we have enough resource? We never have enough resource. And never will. I don't think that's the solution. I really do think that it's the WAMS work, it's the preventative work, it's the training teachers to notice, really being clear what we want our admissions officer or our attendance officers in schools to be doing and how they're trained and managed, because their role in schools have changed drastically in the 20 years I've worked in the borough. So being clear what the system is going to contain these kids and help them stay in school is, I think, a more important issue than funding endless amounts of therapy. And therapy is a failure, to my mind, and I say that as a psychologist. It means that we've not done the right things at the right time for putting people into long-term therapy because they're not going to school.
I've had a few hands that have gone up as whilst people have been talking, but I'm going to have to be a bit stricter so that we can get through as much as we possibly can within the allotted time that we have. Richard, I imagine that you want to come in because
for the benefit of colleagues who don't know me, I'm Richard Brown, head teacher of the Urswick School and also executive head at New Regents College. A few points really. One, I'm sure you're right to identify youngsters not in school as being a key issue. And I think a key issue moving forward for provision in Hackney is what oversight there is of students, young people that are electively home educated by their parents. There is minimal inspection, as far as I can see, of the parents' actual capacity to deliver real education. And so often this is a mask for a lot of other issues. I think that's one thing. I think another thing is about when schools make referrals about some of those lower level concerns, which teachers have noticed, so often those referrals, particularly to Hackney Social Care, don't meet threshold. And so in effect, it's bounced back on the school, who have very limited resources. You quite rightly talked about WAMS as being a training mechanism for staff to upskill staff, but there are then limited resources in schools who are doing lots of other things and seem to be the repository for everything these days. There is then limited resources for schools to act. And as I heard you say, you didn't agree with the idea that WAM should be providing more direct intervention one-to-one or in small groups with youngsters in schools. I question that, but overall I completely agree with the need for early intervention. My concern is that when schools are seeking help at an early stage, they're often then being told that that doesn't meet threshold for whatever service it happens to be. And something has to change in that cycle, because otherwise, as you say, we get much more into the need for youngsters to have acute clinical interventions because things have not been responded to as they might have been at a much earlier stage.
I'm going to bring in a couple of other people before we go back to the panel if possible. So Claudia, Councillor Tevitt Deloff, and then Councillor Binny Lubbock, please.
Thank you. Yes, to add to what you just said, I couldn't agree more, because I think we hear a lot as well that the threshold for young people, children and young people accessing mental health is ever increasing, and that has put a lot and continues to put a lot of pressure on young people accessing the support. My question was just kind of going back a little bit with what was being discussed or said earlier, and it's related to resources, specifically, of course, workforce. I read in the report that the OFF Centre had to close to new referrals for 1 year between September 2021 and September 2022. The report cites vacancies or recruitment, I would imagine it means as well, as one of the reasons. Could we hear a bit more about that, please? Understand perhaps as a council, I think, what is it behind the recruitment challenges, issues, and that would be great to hear. Thank you.
Yeah, so I'll start by, if everyone happy for me to answer the Off Centre question. Off Centre is quite a unique service in the sense that it covers that transition age from 16 to 25. We know that there's a massive cliff edge in services. Once children and young people get to the age of 18, they're expected to either transition into adult services if they meet the adult services thresholds, which, by the way, are generally a lot higher. So we have this cliff edge where young people who have been known and working with CAMS are transitioned to nowhere because there isn't a service for them. So off centre holds that space of that age group, a very vulnerable age group. As a voluntary sector organisation, it is, although NHS commissioned for some of its pathways, as a voluntary sector organisation has a greater vulnerability, partly because voluntary sector organisations tend to have a lower salary scales than NHS providers. They exist as anyone that works in any capacity within or around the voluntary sector will know that a lot of their life cycle is spent bidding for funding and then proving that they've delivered what they were supposed to deliver according to the bid. So there's a series of vulnerabilities around the community and voluntary sector providers. What actually happened with Off Centre was that, yes, they had a number of vacancies around as a result of the pandemic, in addition to which they're supposed to be a service that sees young people with mild to moderate difficulties. In fact, what they were getting is moderate to extremely severe. So on a regular basis, Off Centre was having to walk young people up to A&E, for example, because they were in a state of extreme suicidality and were representing very high risk themselves. And they weren't set up to do that work. They haven't got any psychiatry input, which is a regular feature of specialist CAMS for managing risk, any prescribing services, etc. So they found themselves in a very difficult position where they had an ever-growing waiting lists that they couldn't get through, with a decreased number of staff, and at the same time managing an extremely high level of risk that they weren't able to manage. It didn't feel safe, and so in order to reformulate, do some demand capacity work, and to set up again more safely, they made the very difficult decision to close their waiting lists because they needed to do that work before they felt safely able to operate, which we all found a very, very difficult decision and a really upsetting situation for the young people who would be referring themselves to that service to be in. But in terms of safety and in terms of needing to do the work to reopen, it was probably the right decision for them to make at that time. They have now reopened their lists. As part of that time that the list was closed, they used that time with support, again, a systemic approach. They negotiated a risk sharing agreement with the neighbourhood MAT teams to work with young people over the age of 18 who were presenting with extreme risk, which is what has enabled Off Centre to reopen their lists and continue to work with those very vulnerable young people. So does that answer the question? I think there was a second bit as well.
Around workforce as a whole.
Right, so thank you for raising that, and I think that's something that we touched on in the focus groups. So I think CAM services have faced a significant number of challenges, one of them being recruitment and retention. So like many other public services, I think what we're quoting, I can't remember how many hundreds of thousands of vacancies there are in the NHS at the moment, and mental health services no less than any other service. So from my understanding from colleagues who are running and leading services, there's a constant recruitment cycle with unsuccessful outcomes, in that you either don't get any applicants, or on the day they will drop out, or that anyone that you interview is you're not happy to recruit, and you don't want to recruit somebody that's not good enough.
And just to add to that, it's not just the cost of living crisis that's hit staff, NHS staff in the south of, the south of England. It's also, we can't recruit to substantive posts often because we're funded for 12-month contracts, and people can't do that. They can't take risks to enter. So we have lots of vacancies. We've got about 5 at the moment for our fixed term posts, which are core services, which we've tried so hard to get substantive. So that's, sorry to interject.
No, thank you.
Well,
yeah. You're a clinician leading service, so you know better than I do. I'm reporting what you've told me over years now.
I mean, we are fortunate within Hackney to have the kind of inner London waiting for staff, which does try to in some way meet some of the cost pressures that staff experience working in London. And it's a well-regarded service, which in many ways, I work across at Newham and Tower Hamlets as well, and Newham does suffer more with vacancies and struggling to recruit and to kind of retain people. And some of the pressures as well, which I think the Alliance has considered, is around staff wellbeing and how that affects things like people wanting to remain in services where, they're really trying to deliver a very good service as quickly as possible. But because of the demand and some of the challenges that, we've experienced during COVID and post, it's been a difficult environment to work in. We've also got the challenges of, agencies, being able to offer, more.
Higher pay.
Yeah, higher rates and.
So
and
0 hour contracts are.
Yeah, we have bank staff,
Mm-hmm.
but agencies are different.
Can I just very quickly follow up question? What are the roles that you're recruiting? Because with the BACP, my understanding is actually that there is a large workforce of people that are not employed within mental health sector. So it'd be interesting to see why are the roles that there is a struggle to recruit. It would be important, I think, to.
You mean the BABCP as in CBT registered?
Many specialties. I think there is a misunderstanding. For me, at least, I like to understand where are we struggling as a board to recruit within mental health.
It's interesting. We advertise for CAMS clinicians mostly. I think you do as well, don't you? You don't advertise for one particular discipline. We tend to try and invite people. Yes.
We have enormous difficulties with recruitment when we want particular professions. I think part of that is that we need to advertise for the particular profession we want, and we don't always do so, but we're learning slowly. There's a retention is in some sense is more worrying because historically, and I'm an example. I've been in the borough for just getting on 25 years now. People didn't leave here when they came, which is not always a good thing. But having some movement of staff is good. But now actually people move very quickly and open to work privately because they can't afford to work for the NHS. That's one thing I hear. They don't like the stress of working within the NHS, so they will work in different bits. I have people going to work with do staff wellbeing jobs in the NHS because they don't want to work on the front line anymore. Because it's hard. It really is hard. And it's hard to keep.
Can I just mention also about the zero contract? When we do use agency, we try to give a bit more of sort of longer working contracts, because otherwise we're likely to lose those staff, especially how much effort we've put in. So we would do sort of something more substantive with agency staff. And we do, in cases, we try to over-recruit as well, because it's about being proactive that people will leave and there are different reasons people leave. So as much as possible, we try to minimize the gap that we have within services. But as Lindsay said, we are quite fortunate in that people do want to work with acne. It's not without its challenges, but I think we try to keep on top of that as much as possible. And I think what we're seeing, I was saying to someone, gone are the days that you want to recruit someone and they have to be 5 days a week full time. And now people don't want to work full time anymore. They want to work flexibly. They want to work 3 days, 4 days. So we're also having to be flexible to look for who the best person is for the job, but also being a bit more flexible in how we work.
Or worries me more is people who work compressed hours in order to be able to work an extra day privately to subsidise and afford to live at home. That's goes up a lot, I'm afraid.
It's all right to come back to a couple of points. Have we got time to just see a couple of the other bits of the questions that came up? Or not?
I'm gonna have to be. I think we've got quite a lot of questions we're hoping to get through. So what I'm not very good at being strict. I'm gonna try and be strict and say that, like, for each question, if we can try and figure out who is the best person to answer that question, because it's really helpful. But I think we've got. I'm trying to balance it with what we're hoping to cover. So if that's okay, because I think from what I'm picking up as well, there are a few things that I think would be helpful for us to drill into a little bit more detail about. So what are the drivers? What is the capacity to deal with? Because capacity seems to keep coming up, whether that's the suitability of what is available, or whether it is just, numbers, but also some other questions around the current structures and the data and whether we're insight driven and what information are we gathering, collecting about children and young people across the borough. So if we can maybe try and focus the remaining time on those 3 areas. Councillor Vinnie Lubbock, can I bring you in?
I had a question which was around that date. I'm wondering if Richard's point was addressed. Can we just go back to that?
That's what I wanted to come back to Richard's point, actually.
And I wanted to build on that one also around the drivers. So just to add on to Richard's point, I know that when we did our site visits, what kept coming up was about the context, that the issue that children are experiencing, it's all well and good flagging up. Here's a young person who's going through some sort of distress and maybe needs additional support. But what was coming coming back to us in the conversations that we had, was that the context that the young person is existing within is problematic and is driving these challenges. And be that what Richard has maybe touched on in terms of something that might require the support of children's social care, but perhaps not meets in the threshold. But also there's another question around schools. This did come up for us about the school context, whether that is to some extent feeding into that. So it would be helpful if we could talk about the context and the ability to sort of, and to answer Richard's question quite specifically.
I just want to say that I really understand where you're coming from as a head teacher in a school, and one of the things we've learned over the years of working with colleagues in schools is the enormity of the task of teaching, getting through the curriculum and containing whole classes and year groups of children, and it's been even more challenging the last couple of years. So firstly, just to acknowledge that, I think when we talk about our strategy, our WAM strategy or our MHSTs, we're trying a number of different things just to think about the context of the work. Firstly, just to acknowledge, we on the front door in the SPA, the single point of access, we're trying to bring in our MHST and WAM's resource there. So, because with the same children can enter the service through a number of front doors, but the one central point. So to think, okay, is there a clinician, is there an MHST, an emotional wellbeing practitioner in this school that can do some brief work? If not, is there a WAM's clinician that can talk to a teacher to skill up a teacher to think? Otherwise, can they be referred to First Steps, which is our team, to do some brief work? And so try and think, because what we know is, of all the children that need services, only 40% of them get referred actually. So we don't want the same people seeing the children in a loop. So that's one thing that we're trying to do, just to try and make sure that children are seen as quickly as possible. We're also trying to grow our consultation arm in the service, and that's because the feedback on collaborative consultations with the strengths base, which give teachers, health workers, frontline staff a bit of a space to think about the resources that it can bring, and also what kind of ideas might support them to think about a child's emotional regulation being important. So sometimes when we meet with teachers, they might come with one child in their class that they want to talk about, and we'll say, are there a number of children, how many children is, you're thinking about this bullying issue or anxiety about separation in the morning? Well, I'm thinking about 5 or 6 children, so let's really focus on that. So trying to think about that, it doesn't replace having a therapist in the school, and unfortunately we're not resourced to have therapists in every school for as long as we'd like to be. And I know when we speak to other boroughs and other cities, sometimes schools have different ways of resourcing additional, but schools' budgets are stretched as well. So I suppose it's just another issue. But I just want to say that I really hear what you're saying. And if we could do more clinical work in school, we would. But I think because some of the schools have half a day a month or a day a fortnight, it's just how can we reach the most children in the smallest capacity, if that makes sense. But we need to continue to work with you to find out more about that.
I'm just going to add on to that. I think it's our school staff are doing the work with the children anyway. And as a ex-school teacher myself, the difference between a good day and a bad day was often about how I was feeling in the first place and how I reacted and responded to the challenges that children would bring to me. So teachers and school staff are doing that work anyway, and actually most of the time they're doing fantastic work. They're dealing with things either instinct, not because they've had training necessarily or are informed or educated around mental health and wellbeing, but because they're teachers and they're already doing the right thing to develop those relationships, which is what all of this is based on. But they don't know they're doing the right thing because they haven't necessarily had the training yet. So the point of WAMs is to say, what are you doing about it? That's brilliant. That's really good. You're developing relationships with your students. You're recognizing, the good things that the kids are doing, and now you're having some challenges around this group of children or this particular child. Well, what can we do? Let's talk about that. So skilling up that ability to recognize the good practice that's already going on, but then to think about how to expand that member of staff or that group of staff's capacities. So that's the work, because there aren't enough therapists in the world to meet the needs of all the children that might need a therapist or might benefit.
And she has a team around the schools. Think about the contractual staff that was mentioned earlier. And I was thinking a child might be referred. A child we saw last week had been referred for anxiety and sleep anxiety. And we were speaking to the child actually because they're in a 1-bedroom flat. They've got really noisy neighbours and there's no escape. So actually thinking then with the school. So how can we think about family action or what sort of agency we need to get support to? So it's about working working with the whole team around the school to think, what's the highest context really, the way we need to intervene. And this, because if we always, I suppose that's connected to what you're saying, Roger, if we go down a CBT for anxiety route, then this child is responding with anxiety. It's a normal response to adverse situations, and we just have to think about those things, and we need to give schools the time to do it. So I suppose it all connects really, but I know you had other questions about the schools, so.
But this stuff is helpful for us as a
Yeah.
commission as well.
Yeah.
And it's not to say that like, as a council we'd ever be able to to magic up accommodation for people, but it is important for us to understand what the key drivers are. If it is the same thing that keeps coming up again and again, it is really important for us to know this.
And if I may check, perhaps the need for you to take back to other forums, the need for greater oversight of children who are now being electively home educated, who are a growing number, and that follows on from your points about the number of children who have mental health crises who are not actually in school, which means they are not being seen by any sort of trained professional on a daily basis. And I do think there is a lack of oversight at the moment of families who have decided for all sorts of reasons to electively home educate their children.
I mean, I'll tell you a story from 2 or 3 years ago of a young lady who didn't go to school. She was in her GCSE year. And she didn't go to school because she had a disabled younger brother who used to wake up at night, and she had to look after. She had to look after this kid because her mum had had a stroke. And her mum had a stroke which made her very limited her mobility considerably, but she got almost no adult service, adult OT, adult social care services to support her at home. And she ended up as a 16-year-old having to look after a really quite moderately learning disabled with with autism as well, I think. And so there's a whole, behind this story of this kid not going to school, is a whole range of services not being provided. And child mental health was the least needed service. And yet she arrived at our door, not at adult social care, not at adult OT, not in adult neurology, came to us. And my work wasn't about treating her anxiety. My work was about talking to the adult neurology department and talking to the social services and talking to the learning disability services for the brother. I did no treatment for this girl at all. And it wasn't really a CAMS case, yet somehow it fell to us to deal with it. And what's going on? What's that about?
Before I move over to come to you, Councillor Binnie-Ludbrook, I just want to, just sticking on the point about the schools, I do have a question which did come up for us in the various other sessions that we've had. So then to what extent do some of our schools, it can't be all of our schools, but this is various different conversations that we've also had with young people and the zero tolerance behaviour policies. I know that sounds like a blunt way of describing it, but persistent blatantness and absence, irrespective of why, can, in many cases, for a lot of schools, be dealt with in a punitive way. How are the WAMS practitioners dealing with that? I know from my own background, working with children and young people, about people being persistently late because they're in temporary accommodations an hour and a half away from their school, going into school, falling asleep, getting detention after detention after detention. What are we experiencing this? Are the WAMS, have we got like a feedback loop with the WAMS practitioners to understand whether there is anything about the response from the schools that perhaps in terms of behaviour policies that might not actually be helping?
It's a very, very good but very, very tricky question to answer. So the first thing to flag up, as you'll know, is that obviously CAMS isn't responsible for the way that schools conduct their behaviour policies or any of their policies. And actually not only not responsible, but also not able to force any schools to adopt what we might in WAMS see as a good behaviour policy or set of policies. And actually, in order to work with schools, we have to kind of meet them in a place where they want to work with us. So that's what WAMS has looked like in the rollout over the last 5 to 6 years in 3 different waves, has been very different in each school. So every school, as you'll know, has got a very different character, a very different set of staff, a very different leadership. with different sets of ethos and priorities. So some of the schools in the borough have got wellbeing as one of their 3 annual priorities on their school action plan. Other schools haven't. Something else will be a priority. And so when we start work with a school, it can look very, very different depending on all of those different things. What we have tried to do historically is to not, we offer a roadmap towards what we see as best practice through the Wellbeing Framework audit tool, which has 3 levels of achievement, if you want to call it that, of emerging, established, advanced. And we ask schools to evaluate themselves, because we're not offset, far from it. We want schools to evaluate their own practice and decide where they see themselves on that audit tool. And then off the back of that, we ask them to write an action plan, an annual action plan, where they will choose what their priorities to work on things are. So as practitioners in the system, we might have a very strong view that a school has a punitive behaviour policy, and we think that's leading to a huge amount of distress for young people. And if it was us in the school, we would be changing our behaviour policy. We're not in a position to do that. We have to work with schools where they are. And that's often very challenging. It's very challenging for our colleagues from CAMS who've gone into schools and have seen practice that has distressed them, because they might feel that that's, not best practice and perhaps worse than that. So, but it's a constant negotiation to get.
And just to add to that, Sophie, I think what a good outcome for us of our relationship with school is that we're invited to look at a school's behaviour policy. So building a relationship with school where they trust, they can see, because the pressure on teachers, they've got so results driven, for them to say, actually, so then for a child who's persistently late, for a teacher to say, okay, you're late, what do we need to help you settle into the lesson, rather than let's give you an after-school detention because of that. And only this month, I had a trainee psychologist with me who's working with a child who's just about to be excluded. It's 4 weeks till the GCSEs because she got her tongue pierced. And just to think about, okay, the highest contact rate this child sits at GCSEs. So how can we work with schools carefully to think about what's happening? So absolutely, but we have to really think about supporting, but it has to be built on trusted relationships with schools staff who are under huge amounts of scrutiny themselves. Yeah,
I have to say this is the bit that's a little bit worrying about. If we're really trying to get things right in terms of the services that we feel that we do have a lot of control over as a local authority, as a partnership, there is a massive chunk missing from that piece, and that is the schools that have really regular contact. Like in terms of just on that point that we've just mentioned here, it's great if we've got some schools that are best practice. Yeah. It's terrifying if we've got some that really aren't, because it just means that the type of services that that one school will have a behaviour policy looked at, another won't. The girl with the tongue piercing will get excluded from one school but might not from another. That's quite worrying for me. And I feel like, I mean, it's useful for us to know as a commission, certainly, so that, and that's not saying that we can promise anything. We've tried to do work on exclusions, and a lot of it is, outside of our jurisdiction, certainly, because most of our schools are not
really
our schools.
It's really difficult. All I can do is be curious and try to understand what's going on and why things are happening where they are. I have no power to ask an academy to do anything, and I fear you don't either, and that's the problem, isn't it?
At least we can make
that power over, and I keep saying the same thing. It's like a broken record. Elective home educated kids. The school is required by law to take a child off roll and to refer that family to the local authority, who are then meant to check on the capacity of that family to educate that child. Now, to my knowledge, and I wish perhaps there were others from Hackney Education here who I could ask this to confirm, to my knowledge, there is one member of staff allocated to that role, and there is now a huge increase in elective home education. So yes, we can spend a lot of time on what the Commission, in effect, doesn't have much control over, which undoubtedly is schools. That's the way the government have set things up. But there are things that Hackney does have direct oversight of, and one of them is EHE kids, so do something about it.
I also, is it all right to just respectfully disagree with my learned colleague?
We do.
I actually think we do have a bit of power in these situations, because just to take the example of this girl, what happened, this was on the back of her being consistently late because she's got a very depressed mum at home, and it was a bit connected, lots going on for her. What it led to was a series of meetings with the school and very clear emails copying in as many people as we could to say, of course, I'm sure you share in our hope that this child sits her GCSEs. And what happened was an about turn in their decision. She was about to be sent to the governors for a meeting about whether she could stay in school. So we came away thinking, actually, collectively, we can do something about this. As long as we work collectively, we name things and we call them out. We know too many black boys are excluded from school. We know that's still an issue. And behaviour policies are quite punitive on certain groups of children. We're missing things. I think we've just got to continue to call. I think we can, collectively can do, but it's about a bit what you were saying before, Beth. We can't do anything on our own, but we can kind of collectively kind of change things, I think. Yeah.
It's, I guess, when they're being curious.
Yeah.
I can vouch to what you're too curious.
Yeah.
I think the professional point there back to that is that that's very time intensive as a clinician. Someone who sends lots of those emails and appears at school to try and capture it.
Which we've been doing, Beth. Yeah.
You hop on your bike and you do it, but actually that is, we're also talking about wait times in relation to that. So yes, you can do that influence. You can have those curious discussions. And sometimes if you've done it before, it's easier with a school because you've got relationships with particular people. That involves retaining staff over a period of time. But it's important work, but that work around the clinic appointment is actually a really important piece of work, that it's not just that hour in the room when you're seeing a family. It's the much broader consultation and work around that, which produces lasting, changing. That's a lot of.
It's so true. We're not measured on it. We're not evaluated on it by our commissioning, unfortunately, because it's about clinical appointments. So a lot of the kind of indirect systems work, we're trying to find ways of capturing it that's meaningful for our commissioners as well.
We found ways of capturing it, just no one is interested in reading. We do have to
take another couple of questions before we're going to have to move on. And just as a reminder, if we can avoid talking about cases, just in case people might be identifiable. Councillor Binny Lubbock, and then I think Councillor Gordon, please.
So I just want to zoom out again pretty quickly. Obviously, you've demonstrated there's a complexity of governance. You've got lots of different organisations working there. I'm wondering, where does the strategic decision making sit, and is there a governance framework and data for effective oversight of the mental health provision and just making sure that it's responsive to need? Because it feels like there's a lot of moving parts to it. And we heard from focus groups that there are challenges around data, and good to hear that it's a systems approach you're taking. And the systems approach was highlighted recently in the HUE review of integrated care systems, and big focus on sort of interoperable and transparent data. Are there some solutions that you're kind of looking at around how to make that data as effective as possible? For example, obviously with WAMS, is there data around correlation between mental health outcomes and academic performance? And we heard recently about racial inequity in exam performance and things like that. And so can we use the data to pull out some of those intersectional issues?
Can I answer the first part of the question, then I'm going to let Roger answer the second part of the question about data. Like that. So in terms of governance and decision making, obviously the CAMS Alliance is an alliance that incorporates any services and partners delivering any kind of mental health service to children and young people. So the CAMS Alliance takes decisions and prioritises, but just for the services for the wider partnership. So going back to that notion of mental health and wellbeing as everybody's business, the CAMS Alliance reports into, along with other services, into the Emotional Health and Wellbeing Partnership, which if you look in your briefing pack is part of a whole governance structure right up to the Integrated Care Partnership. So that's, and I think we've shared through the briefing pack and through the presentation at the beginning of the session, I think we've shared how, as a partnership, we decide what our priorities are and then work towards addressing the challenges that will help us to improve the situation for that. Let's say that it's a cohort of children such as autistic young people or eating disorders or LGBTQIA+, and the challenges that they will face. So that's really done through the CAMS Alliance and the Emotional Health and Wellbeing Partnership. I'm going to hand over to Roger to talk about data.
what, I'm not sure I'm entirely sure what it is that you want to know.
Well, it was just because we had in the focus groups about the challenges of not having a sort of a one data view and all of these different organizations having different data sets and things like that. So I'm just wondering if there's a new approach to data, or is there any solutions that are being explored?
Yes, the short answer is yes. The long answer is for years I have been promised by NHS England that we will have an interoperable data system. Every year I get told it'll be a year's time, and it doesn't come. So we've given up on that. It will happen probably after I retire. In the meantime, we have what we've done as an alliance. We've agreed like a minimum data set. We're going to present our data in a particular format. These are the key metrics we need to manage the system, and we're now busy working out how we're going to get our informatics departments to produce that data. And it's already beginning for the single point of access starting to come, and we will slowly build some of what we know in terms of activity and in terms of referrals we can do now, but we have a work plan to start to build a data set that will allow us to manage the system, because at the moment we can't, is the short answer, and it's just not okay.
Just to add on to what Roger said, some of the organisations that we're bringing together, they were initially a while ago commissioned in different ways, and we were asked to present data in different ways. So when I think about working with social care and some of the ways in which they collect information and report it to certain areas within the NHS, we have a similar kind of data set that's been created by NHS England, but then there are local identifiable things that we'd all like to look at together. The strength of the alliance is that we can just together work out how we're going to do that and manage some of the pressures that we receive of lots of different people wanting to see our data in different ways, and the resource that it takes to do that. There's always a bit of a balance to be kind of made there around employing lots of people that will help us look at our systems and be there available to accept information requests and cut data in certain ways to be able to meet lots and lots of different needs, because lots of people are interested, versus being able to deliver services. And that's where some of the balance is. But I think we're getting there.
No, I mean, I think in our different organisations we have different difficulties. So in Elft, CAM services sit as quite a big part of specialist services, which sits within a very large organisation whose primary focus is adult mental health. So we're a second or third thought when informatics are being developed. That makes life different. But we have now got new structures where our needs are being recognised and dealt with more quickly, more appropriately, to my mind. You would speak better to this than me, but I have a sense that in terms of your position within the Homerton, you have a similar issue. Acute health is their primary business. Your business is something small that they haven't got the resource to manage.
Yeah, I was actually just going to connect to something else about data, which is one of the things that we're really trying to look at with our data at the moment is about health inequalities. And in fact, Beth could probably speak to this better, but we are looking at how we capture ethnicity data in the borough, the white other category. You might want to speak to this more, but we're looking to, yeah.
Well, just that, it's very difficult to reflect, we're in a borough with a very large Orthodox Jewish community, which is a really important that we're providing that, and also other categories just don't reflect the diversity. There's a very large Vietnamese community, and we in terms of measuring whether we're actually actively working in ways which are offering an appropriate service to large proportions of our communities that we serve. And where they sit, a lot of these groups are hidden within the data, and they see the forms, and it's also very painful clinically, how we're talking to people about how their identity and how they manage, and then you've got to tick a box which we all know what that's like when you see those forms personally, and how do we collect data in a meaningful way to reflect.
And that's before you go into the mixed heritage.
Yes.
Where I do a family tree with someone, and I've got the entire world represented on the picture.
But that's been really important in shaping, for example, a lot of the work that we took, going right back to where we started about early intervention. We're trying to base ourselves we've got staff working within the Muslim community, African and Caribbean communities, Turkish-speaking communities, Orthodox Jewish communities, to do with where we can see gaps and where we're not reaching the families we need to reach. So we need to continue to collect that data meaningfully to see.
And so we're doing, some to do, do it ourselves with our own data, in the area trying to do it, but actually, and also working in partnership with colleagues to shape the kind of questions that we ask and asking families how they want to have those questions and starting a piece of research, thinking about that and beginning to do that across the Alliance. It's a shared goal for all of us. I think that it's so important, isn't it, that data represents meaningfully the rich borough that we live in, and even our language that we're using. We're not talking about global majority, but we're thinking and happening around that. So it's just thinking about how we're doing that, because we do so much work in partnership with voluntary sector organisations, with colleagues, and we have we also have a staff team which needs to represent the community, and we're thinking about that and working on it. So
absolutely, and back to where we started with the neurodiversity, the huge rise in requests for autism and ADHD assessment. We need that data because we need more funding into that pathway. That is an unacceptable waiting list that we are working so hard. We've been doing waiting list initiatives in both of our teams to just try to get more and more assessments through the front door, but the requests are increasing as people's detection is better in schools and in families, but we need we just can't do it with the resource that we've got, but we need the data to evidence that. So
and with gender identity services as well,
yeah, definitely, yeah.
I think we've just got a follow-up question from Councillor Gordon, and then I think we're going to have to move on.
Thank you very much, and also I think thank everyone for coming this evening. I mean, we've got a sort of incredibly impressive array of senior staff who've given up their evening from across the Alliance. And I think we've had a wide-ranging and complex conversation. I think it's revealed the passion that all of you have, for these services. So thank you. I think my follow-up question really was, thank you, Sophie, for describing the governance structure. It's obviously a complex governance structure, and it's quite difficult, I think, for the community and even the Commission to understand. How have you given any thought really to you're obviously, there's different parts of the service, you're subject to different inspection regimes, the ELF service is subject to CQC, there's Ofsted has some role in children's social services. Have you given any thought really about how we can evaluate how the partnership as a whole is operating, and what sort of targets you have? And you've obviously talked about sort of place-based service. So I mean, what should we as a Commission really be looking at to see how the Alliance is being successful and moving forward to serve the children in our community in need?
Can I just clarify if we're talking about the CAMS Alliance, the Alliance group of providers, or are we talking about the wider emotional health and wellbeing partnership?
Both, really.
So yeah, I can talk a bit about the emotional health and wellbeing partnership, but I'd like to hand over to my CAMS colleagues to answer the CAMS bit. From an emotional health and wellbeing partnership, and this is partly why we're looking at updating the strategy and of course the action plan, as the councillor here mentioned. The magic word is integration, isn't it? And I think there were a couple of questions, I can't remember who from now, about how what the interplay is like between social services and what the data is telling us. There is still a fair amount of I'll be completely transparent, there's a fair amount of siloed working even within local authority services across different departments and service areas and teams. And so, for example, we've developed a single point of access for CAMS. What we'd really like to see, I think what we should be moving towards, is a single point of access where any level of need that requires some kind of support, whether it's advice, whether it's signposting, whether it's a referral, whether it's intervention, whether that intervention is low level, medium level, very high level, right up to the highest level of need. It would be, for me, it would be really helpful if parents and families, because let's face it, that's who we're here to serve, and young people, if there was a really clearly offered, a really clearly communicated offer that all of us knew how to navigate and how to access. For me,
And it's fair to say that we're working towards that. We've got a sort of deadline in our minds, hopefully. I mean, I shouldn't really say it, but in the next few months, of trying to co-locate, certainly within social care, so that there's one front door, social care, voluntary sector, CAMS, so that we avoid all seeing the same families and families repeatedly telling their stories to a number of different professionals. But also, I think the other thing to add to that, Sophie, about this single point of access is we're getting data. We're really closely watching the data about who's coming in, where they're going, how long it's taking them to go. So I come with a folder full of that. We haven't got a chance to talk about that, but the time it's taking from first triage to the next step. So we need to, that's.
Can I also add that I think there's also something about that single point of access, but also part of placement work, that the model has a government structure really around also having a range of providers. So in terms of, first steps being in children's centres and GP practices, and so actually you've got multiple ways into the single point, if that makes sense, and different communities access in different ways through voluntary sector organisations that they're working with, so that they know in ways. So it is both a single point and it's also multiple entry, if that makes sense. There's almost something about having a diverse routes in, which I think is really important part of that as well. I don't know if that also is a part of answering the question.
I think there is a recognition, I think, on our part that's the solution is clearly something that is as fragmented, because our communities are that fragmented. Our concern is, how do we know what's working, and how do we know, because it just feels like, by the sound of it, collecting the data we've already got capacity issues, and then we're talking about building capacity in an area that, how are we going to know what is working? Why is it that Black boys are overrepresented here and underrepresented here? Why is it that all sorts of children, how are we going to know?
One of your questions to us, by the way, we didn't get a chance to get it together before the meeting, but I've bought copies of what people have said about the different bits of the service and evaluations of the bit of the service, which I'm happy to leave. It doesn't include WAMs, but it just does include some of the communities. Again, it's kind of anecdotally what parents have said when we've captured, but there's more to learn. We've got more to learn. But I'm happy to pass these around if people are interested.
Very helpful, thank you. And I think it's important to say that, just as colleagues in the room have said about schools, I think I speak for the whole commission when we recognise the context that everybody in this room is sort of working within, and I don't think it's a case of reviewing services and say, oh, this one's terrible. I don't think that's the case. I think it's more a case of what might we in an ideal world need a bit more of, or what is actually quite an effective way of dealing with a particular thing. And it just feels as though the resource issues are spreading.
It is about that, isn't it? It's about that ability to team up around. And I like Yvonne's idea of the team around the school. That's a really helpful way of thinking. One entry, and it's about supporting young people in the context of their school, and it's supporting the school with some really difficult young people and families that are really hard to meet their needs. And actually we do it better together. And that the success of that model, I think, is a really important thing to look at, not just for CAMS, but the whole early help support. It's a key part of the model.
Yeah, it's just very briefly as well. I think, and also perhaps for future, as you were saying about data and understanding whether it's working, I think it would be really good as well to know if there is also emerging trends through COVID, cost of living crisis, food poverty. What are those triggers? What are those presenting issues bringing young people, children and young people, to mental health services, crisis A&E, and etc. It would be really, really useful to understand that, and to have a bit more of that in-depth knowledge of that.
Absolutely.
I was going to say something about thresholds. Sorry, I know you asked earlier about thresholds, and I was mindful that my understanding of it is that we've got no lower thresholds.
Technically no level threshold, but it's under threat, I think, owing to the demand of that you're under in CAMS.
Yeah, so that sense in terms of asking, someone was asked about thresholds, we try. That's why we have the range of offers around workshops, parenting groups, the WAMS offer that actually there is. That's why no one's having the there is no
if a mental health wellbeing service is the right option,
Yeah.
There's no lower
Thank
threshold,
you.
but sometimes we're not the right option.
Yeah,
And you're better off going to someone else if it's available. That's the way I would put it.
Thank you, thank you.
I'm going to have to bring this item to a close. Thank you so much. It was a really helpful conversation, and actually the way that it works in quite a fluid and organic way added to that. And just to say that we've got quite a few things to reflect on before we can sort of think about what our recommendations will be following this. I think we've got to write up some notes from the focus groups and sort of come together and have a think about what's been shared both this evening and when we've spoken to some of you here today on previous occasions. But thank you so much for your work with our children and young people in the borough, and for giving up your time this evening and joining us. You're more than welcome to stay. You'll probably or might not want to, but we'll be moving on.
Part of a picture from specialist cams or this community cam, just because we were asked to just give it an indication of what. So sorry about that.
No, that's okay. Thank you so much.
And Councillor Conway, can I just thank you and the Commission generally for having, you know, the press work scared at the Scrutiny Commission. The whole process that we've engaged in through the, you know, putting the briefing pack together, which has been useful for us as well. The focus group, and then this meeting also has, I think it's been a very supportive experience for all of us as well. So thank you also to you.
Absolutely agree.
Oh,
Thank you
good.
for having
Don't be
us.
scared.
I wish to know more often.
Thanks very much. Have a good evening.
Thank you.
And it's yeah, no, I really agree. Yeah, maybe next time. Nice to meet you there. So nice to meet you. Thank you for the questions. Yes, I know, it's so good to have an audience. Absolutely. Wow.
Okay, apologies to Deputy Mayor Bramble, who's been hanging on online, waiting for her slot, which should have been about 25 minutes ago. So apologies for that. So we're now moving on to the Cabinet Q&A with Deputy Mayor Bramble. So Cabinet and members who have responsibility for children and young people's services are invited to the Commission annually to enable members to scrutinise services within their portfolio. The Commission may identify up to 3 service or policy areas on which to focus its questioning. For this session, the Commission requested that Deputy Mayor Bramble, who's the Cabinet Member for Education, Young People and Children's Social Care, respond to questions on 3 policy areas. So Hackney's offer to schools, Young Hackney's offer to schools and the quality and outcome of this work, children placed in temporary accommodation and the impacts on welfare and support available, and children who go missing from care. So the full details of questioning is contained in the agenda pack on page 39. Can I suggest that we take one policy area at a time and invite Deputy Mayor Bramble to give a response to set questions for each area for about 5 minutes or so, and then we could have some follow-up questions afterwards. So over to you for the first question, please, Deputy Mayor Bramble.
Thank you, Chair, and I hope you can hear me clearly. Sorry I'm not there in person, but I'm not 100% today, but miss being with you in person, as this is such an important meeting, and really great to hear some of the work around health and wellbeing in the previous item. So one of the first things you wanted to know about was the key areas that Young Hackney offers schools. So the majority of our secondary schools have a link worker from Young Hackney. That's 14 schools, mainly in the maintained sector, but also Stormont House and can see Richard there, New Regents have a Young Hackney worker. So hopefully that hasn't changed by the time I'm telling you this. So Richard's nodding positively, so that's really good. And any school that doesn't have a link worker can still make referrals into the service to the team. And staff then will work with Young Hackney to identify the support that will help children to be able to participate in education, but also achieve their not just academic but social and emotional goals within the school setting. School support can be for individual groups of children or larger cohorts. It just really depends on the intervention that the school needs, and that could be delivered within the school or using resources within the wider community. I would say that primary school age, the support is mainly around transition, but not exclusively so. But it's really that focus of children, young people moving from sixth form when they're the oldest, confident, everyone's looking up to them in the school, then that inverse of being the youngest and needing support and knowing how to facilitate that. There's a number of different offers that we offer at schools. I've been in with our teams when they've done a session on substance abuse and how to manage people if you're being homophobic within the school environment and how you manage that. So our PHSE, which is personal, social, health and economic education, there can be lessons, there can be assemblies from the team, and it can be around sexual health, it can be about substance abuse, healthy relationships, being online, and sometimes it's around weapon awareness. You can have a targeted group session. Any of us that have worked in schools in any capacity will know that actually each cohort is different and there could be something that's happening within the community. So you can imagine around the pandemic and lockdown, the support that you would give and teachers and schools and children need is very different now coming out post pandemic or even pre-pandemic. There's support around sports, lots of supports around schools. We've got holiday programs, we've got an ambassador program where young people can sign up, 25 if they're in SEND, to be an ambassador. That those help us support events that we're doing with young people. Their representatives, their travel's covered, and they get to go through like a really short course with us. That's they get a certificate at the end and all of that. So staff can have drop-ins, workshops and consultation from our team. I think one thing that's really good is that we offer drop-in sessions for students, and that can be an array of help with your CV, stress with exams, managing your behaviour, managing stress. I think I've talked about one-to-one targeting, and there's also support for our young carers chair, giving teachers, support staff the confidence to say what's on offer. And we've got some programs. I think it's Cardinal Pole, Mossbourne Academy, and Clapton Girls at the moment have we have some drop-in sessions for our young carers there, but all of our schools have support and can signpost. I wasn't timing myself. Do you want me to pause there, Chair?
Yeah, I think that's a good point to pause that. I'll hand over to the Commissioner for some questions. I'd just like to kick us off maybe. It all sounds great. I think the concern that I have is, did you say 14 schools have a link worker?
Yes.
And that's across primary schools and secondary schools?
Secondary, yes. So primary schools, it's more of a hub model where groups of primary schools are supported. In our mainstream secondary schools, we try to get one link officer per school because the need is different in the secondary sector, and the pastoral care and the support that was in primary isn't there in exactly the same way in secondary. So the focus has been more on one school, one link officer in the secondary, not in the primary.
How many secondary schools don't have a link worker, and why? I'm just, because I suppose for me, I'm just wondering about the continuity of this sort of offer across the piece. Do we know how many?
So I think it's only about 2 or 3 schools that don't have a link. And I'm speaking to Young Hackney about that, and I think it's more a resource issue. But those schools, although they don't have a dedicated link, can still speak to people in the team and get the support they need. I think what it is for those individual schools that don't have a link, they don't have one designated person that has a guaranteed link and someone they know and have that continuity in terms of building a relationship. But all of our secondary schools have the offer and can refer in at any time. And we're just working on that really for those. I think I want to say it's 3 or 4 schools that don't have that, and we're working on that.
And do we know of the schools that do have the link workers, or even the primary schools that have another sort of style of relationship with young Hackney, that the engagement is fairly consistent? So for example, where you mentioned some of the sort of courses and drop-ins and different sessions, is the take-up of those, the offer, fairly consistent across our schools, or is there more that can be done to better engage some of our schools?
I think that broadly, most of the schools now, I think, engage in the offer. I think that where some schools maybe don't engage or may have not taken up on an offer, there's an opportunity when our support officers going through Hackney Education, where they have their termly updates with the link school improvement offer, to then talk about and be reminded of what's on offer, and if we've noticed anything locally, can suggest some support that we can offer. So during the pandemic, Children's Social Care and Hackney Education were working a lot more closely than was before, and we felt that even though we are post-pandemic, there's no reason why we should not be working so closely. So there's always the opportunity when Hackney Education are going into school to talk about that wider support, especially, as I said, if we've been contacted outside of that by parents or people raising concerns. So yes, I think the take-up is a lot better now, but there's opportunities for us to speak to schools about that offer in their termly update meetings.
That's helpful. Thank you very much. Do we have any other questions? Councillor Suso, Runga, and then Joe, and then Councillor Gordon, please.
Well, thank you, Chair. Could I ask about the offer? How does Young Hackney assess the quality and outcomes of this work with local schools?
Deputy Mayor Bramble, just before you answer, can I take another question from Joe, please?
Thank you. My question was, to what extent does Young Hackney interrelate with other school support services such as CAMS, WAMS, or the re-engagement unit rather?
Yeah, over to you, Deputy Mayor Bramble.
Thank you so much, Chair. Thank you for those questions. I was just looking back through some of my notes, and I think it's mostly just the Garden School and ICRA School that don't have a continuity link. But I'll make sure, if Diane doesn't correct you, if Diane's online, so if she corrects me, then I'm not offended. But if she doesn't come on and correct me, it's just ICRA and that don't have it. But they work really closely with the re-engagement unit as well. So there's making sure that support there. But let me go on to the 2 questions. So I think question 1, the first councillor asks about the assessment and the quality of outcomes, and I think it's really important, because it's one thing to say we do things, how do we know what that looks like? So there is a secondary process protocol that's in place, and it's targeted early intervention support, and whether we monitor individual and group support. And then we recommend that the school has identified school lead, which is called a designated senior leader, a DSL, but that could be someone in pastoral care or head of year. For example, different schools will have different persons. That's what's called a single, I want to get that right, single point of contact person, and simply because we want to be able to go to one person within the school. They will have a half-termly meeting and go through the process of what will be delivered, and then looking at the outcomes. What will be identified is the actions that needs to be taken, and that will be discussed in the multi-agency team meetings around that child. And then the measurements of success, I think they focus on the progress made. So it's looking at the level of vulnerability and the risk that's been reduced. And it may sound simple, but listen, if you are the person that sees all those children in school, has there been less sanctions been received by that child at the end of that time in school? And that's just one of the ways that we monitor the progress around the children. There's also a group session of evaluation for young Hackney around PHSE, which I explained what that was for. And we look at the sessions of the students' prior knowledge, which is something they do in schools, and then post knowledge, and look at the increase of the knowledge and intel of that child. It's linked to the teachers, it's linked to the national curriculum, and it's also what's accredited through the AQA, which is the assessment body. The substance and mental health and wellbeing curriculum is delivered through PHSE, but it's separately evaluated and reported to our public health team. So going on to the second question asked by a member of the Commission around how it all integrates. And again, it's there's a team leader that attends the internal meetings that are held for the school when you're discussing the most vulnerable children around mental health referrals and our early health referrals. And that then provides the interface for all of those agencies, whether it's wellbeing and mental health in schools, whether it's our mental health support team, whether it's the re-engagement unit, whether it's the wellbeing and mental health services in schools. I'm really trying not to use all the acronyms. And in those meetings, you have the interface to pulling all the necessary people to discuss those children. And depending on the nature of the meeting, everyone who's relevant will be identified beforehand. If something new emerges in that meeting, that person will then be contacted, relevant information shared, and in subsequent meetings, those people will be involved. And those contacts are shared across Young Hackney and our wellbeing and mental health services within schools. So there is a real continuity of care, but it's making sure everybody, it's sort of like a team around the child approach, really. And sometimes, if it's relevant, you may discuss and support the family through that, but obviously the family has to be willing to do that. Thank you, Chair.
Thank you very much. I've got a question from Councillor Gordon and a question from Richard, and then I think we'll move on to the next question.
Yeah, thank you very much, Deputy Mayor Bramble. I'm sorry that you're not well, and I hope you recover quickly. My question really, I think, is the role with Young Hackney of sort of supporting children in relation to their relationships with the police. Obviously, you know, where schools have police in schools, and how that is assessed and evaluated. And also they've got a complex role in relation to supporting young people. Sometimes these are the same young people when they're victims of criminal activity, and also when they're vulnerable to being criminalised or have been in contact with the police. I just really wondered how those different roles are sort of measured and evaluated, and what sort of understanding you have of how successful they are in those roles. Thank you.
Before you come in on that one, I'll hand over to Richard for his question.
Just a couple of things, Councillor Bramble, if I may. First of all, the system that you're describing in terms of the single point of contact and the half-termly meetings is relatively new, and followed on from a head teacher meeting with secondary heads meeting with the head of Young Hackney, which was last October. So I'd like to request that you ensure that there is a review of how this works, because it's fair to say that secondary heads had some reservations across the board, not in terms of individual schools that I run, but across the board in terms of the consistency of the quality of service by Young Hackney. The other thing I would like you to look at, if you're not able to answer it now, is about the proportional number of referrals where actually a family doesn't engage because a parent doesn't consent. Because quite often schools are given feedback that a referral has been made to Young Hackney, but because the child and family are not consenting, there is nothing further that Young Hackney can do, and they close the case. Now, that sort of leaves the schools between a rock and a hard place. And so I really would like to see more about that, because there may be more creative means that can be used to get a greater proportion of families to actually engage. Thank you.
Over to you, Deputy Mayor Brumble.
Thank you. So in terms of policing in schools, I know that with Hackney Education, there has been some work done to review the policies and procedure around police in schools and community safety officers in schools and what that looks like. And I know that Hackney, as a borough, have been working with the DfE to get national policy updated and changed around that. So there's a very detailed guidance that has been given to schools around that. I think one of the, I suppose I'm sort of drifting in relation to the work that we've done in response to Child Q, and I suppose why I'm saying that is relevant, that one of the recommendations is that now ensuring that a senior leader is overseeing the whole process if police are called in schools, which hasn't always been the case. And you know, it's not to say that if you're not a head teacher you can't oversee it, but actually something of that severity is better when you have that senior leader there, because ultimately people go to the head to do that. In terms of managing those relationships, we continue to work with our community safety team and Councillor Fajana Thomas, and working with account and all of the different streams that sit not just in school and outside schools, bringing young people and the police together to re-establish and build that trust. It still needs a lot of work and still needs a lot of time. I think there's an opportunity. I would imagine that I would leave it till the end of the summer term for us to review the protocols that have been put in place and go back to head teachers and ask them how they feel about the guidance that we put in place, how that's worked and how we review it. And that's an ongoing procedure, but we've also got to make sure we keep the voice of the children and to a degree in parents in terms of their input around that. So I hope that answers your question, Councillor Gordon. So yes, we're doing work. It is being reviewed, and we have to work really, really closely with our community safety team around that, because it doesn't just sit with us, because they do input work, and the yacht team, although it's not around youth offending, it's a part of the team that works closely with us on that. And also there's been a big piece of information where we've given young children, if they are stopped and searched, the information that they have. It's a really uncomfortable thing that I wrestled with, because I felt uncomfortable us telling children, if you get searched, that's what's happened. But I have to move beyond my own emotional feelings and respond to the lived reality. And our lived reality is that our young children are getting stopped and searched, and if they are, how do we equip them? So there's a little booklet that's been put in that place. And so our emergency agency team meets with schools to make sure that they're getting the right support around policing and education and how we work with police, and also having discussion with schools, because you know, schools might often think, oh well, once the police come in, the police can be in control or leading this. So it's equipping school leaders so they understand their rights within the context of their school, even though another agency is involved. And those are the real life conversations that we're having to ensure everybody is well equipped. And you can't make the assumption that a head teacher will necessarily know what to do when police come on the premises as well. Even though they're adults, they too think, oh, actually it's the police. I'm not sure, so we'll maybe divert to them. The second question was about, Richard talked about reviewing the system. You're right, and good to pick up on it. It's a new system, we have to review that. And I know Diane's online, and we'll definitely have to review the process of looking at how that new system works for Young Hackney. Is there more continuity of care now? You have that one officer, how does that work? And making sure that we as a council are ensuring that there's continuity on the I really think there are always people that we really enjoy working with, but we have to move away from a system that people are only feel reassured if you have a particular person that you're working with. It's always about a good offer, no matter who's going in and delivering support in schools. So there is an opportunity to review that, Richard, and we will absolutely be doing that. I think that's everything, Chair, but do come back if I've missed anything.
I asked Antoinette about referrals where youngsters and families don't engage and whether any data is collected about that.
Richard, yes, sorry, that was it. And I looked at I wrote it down. You did talk about consent. It's a really difficult space, and it's something that we're always considering and thinking about how we can better inform parents so they can make an informed choice and understand the importance of engaging with us around support. But it's also working with and listening with families in terms of what the barriers are of them seeking support. Is it a negative experience that they've had with the school, so they don't want to engage in? Is it a negative experience that they've had with councils or non-statutory or statutory services that they don't want to have consent? But it is something that, yes, we have to monitor and keep a track of, but it is particularly difficult. You know, all youth work and early help is built on consent, and we're continually talking to parents about the benefits of engagement, and actually really stressing that giving consent at this stage is not about control or blame or domination, but actually we don't want it to get acute. We don't want it to be statutory. We don't want it to escalate. So consent at this stage, when it's non-statutory, is the best thing, and we just continue to emphasise that.
Thank you very much for that. And there's been a few things that have come to mind for me as we've been sort of speaking about to what extent is the role of our, you know, I suppose that young Hackney workers have that connection to the young people in the schools, or they have the potential to be very much rooted in the schools and to feed back what they're picking up from those schools back into, you know, what our wider offer is to schools. So is it around, maybe there is a bit more that we could do in young Hackney to allay, or try at the very least to allay the fears that children and their families might have around working with young Hackney workers, which I think is a pervasive sort of issue about services, especially families who have had experiences of services. It's sort of doesn't matter whether they're statutory or not, it's services. But I wonder whether there's any more work that can be done around that, and also in terms of sort of bringing young Hackney a bit more into the fold around the work that is being done around policing, because what we are repeatedly hearing is that young people are experiencing quite a lot of trauma, be it through being persistently stopped and searched, or experiencing things happening. You know, I think you'd be lucky to have a young person who's sadly gone to school in Hackney, doesn't know of somebody where something has happened to them, whether it's something that they've witnessed themselves or something that's happened, you know, close to home or at their school or whatever. And I suppose it's just about, it's not always, these won't always be the young people who end up in the criminal justice system. They might be victims and their link to the police has been fleeting, you know, and yeah, it's just a bit of food for thought about whether young Hackney might be able to play a bit more of a proactive role in terms of disseminating what that key learning might be that we hold as a local authority. But I think maybe we'll give it some more thought after this. But yeah, handing over to you for the second question around children currently placed in temporary accommodation by the council.
Thank you, Chair. So yes, I want to. This is something that's really important to us in children's social care, and the numbers of children that are in temporary accommodation, I'll go through them in a minute, is significantly low. Now, any child in temporary accommodation is never something that you want, but I do think because children's social care and our housing team are working so much closer together now, that we're reducing that amount of numbers. So, for example, the alert system, if potentially a family will be present or deemed homeless, there's an alert from housing that goes across to children's social care, so that the social care team are fully aware of that going forward, and that works a lot better, a lot swifter now. So the housing team reported to us that there are 3,621 children living in temporary accommodation, which does seem like, you know, that's still a lot of children, even though I said it, I know it's significantly lower than some other boroughs. 123 of those children are open to children's social care services, which is about 5% of all of our children. And these children are predominantly subject to what's called a children and family assessment, and or a subject to child protection need plan, and they are also held in our early health services too. I can give you a bit of a breakdown. So children in need, the total is 517. Of that, 41 of them are in temporary accommodation, which is about 7.9%. Child protection is 193 children. Of that, we've got about 15 of them that are in temporary accommodation, which is just over 7%. Early help, we've got 705 children, excuse me, Chair. 30 of them are in temporary accommodation, and that's just over 4%. And then the last figure that I have for you is our looked after children, where we have 380 children, and of that, 4 of them are in temporary accommodation. So the non-statutory children that we have open cases is 34. And when it's non-statutory, it means where we've made a referral, but we don't need a formal assessment. And we've said, okay, you can work with our family department. Our statutory services is 976. 61 of them are in are in temporary accommodation, and that means when you've had a section 47 assessment, and you have to take those formal proceedings. Yes, did you want me to pause there, Chair, or say a bit more?
That would be helpful, I think. We've got some really helpful numbers that I think will help to inform some of the questions that I think the Commission will want to ask. I wanted to kick us off by asking a question around the sort of alert system that you said that's in place. What's the likely outcome of, you know, if a case is flagged to children's social care, how could the outcome then differ from previously when that perhaps wasn't the case? And can I ask whether there might be some cases that are hidden, insofar as if a family is moved outside of the borough and the child is a child in need, the child could be a child in need in the borough that they're living in? And am I correct? So I wonder whether there might be some that are out of borough, which I know that we've really got those numbers down, but is there a chance that some of those children who are outside of the borough might have children's social care intervention with the local authorities that they're living in? So we might not have a good gauge of what the sort of the impact of temporary accommodation has on that cohort specifically.
Thank you, Chair. So I think in terms of the difference, it's sort of it's the awareness. So beforehand, families could be presenting, become homeless, be in temporary accommodation. Children's social care wouldn't necessarily be notified of that straight away. So I think that's one of the immediate differences, that children's social care now know quite early on. It doesn't make a difference in terms of the allocation, because housing have their duty of care, and as you know, there is a housing crisis, so we can't necessarily say that family can't be placed out of borough. But if it's a family that's known to children's social care in any way, there's opportunity to share information, and that information can be taken into consideration around the housing duties, because obviously without that intel, housing would just make their referral. So it is a lot better. I think the challenge is the stock isn't there in the way that we need. So you wanted to talk about what happens if a family is placed outside of the borough, there's a few things that happen. So the new local authority has to be identified and notified of that change. Any existing support for that child or family, those arrangements have to be notified to them, and that arrangements has to be put in place. Families that automatically come into temporary accommodation aren't necessarily assessed for support, but if they need support could be had to them. Families have a role as well when they move to the boroughs to lead on talking about the assessment and the support that they need. But ultimately, once families leave Hackney, even though we've placed them, the support then does close down and the new local authority follows up. But depending on the nature of the support that's in place for the child, the social worker or the key Hackney workers do link with the agencies in the new local authority.
I suppose what we're getting at with this question, I think we're all in agreement that temporary accommodation massively impacts children, you know, especially if you've, you know, we heard from children and young people who I think from Youth Parliament, who fed into a session that we had during COVID, talking about how do you access mental health services over the telephone when you're all in a room together in a house. You know, it's or how do you do your homework? It hasn't. We all know that it has an impact on everything, and I suppose, well, it has the potential to have an impact on a lot of things. But I suppose it's food for thought, isn't it, for us? And that's not to say this is anything that we can prevent necessarily, given the housing crisis that we're experiencing, but that there is a cohort of people who are being moved out of the borough whose circumstances we don't really understand very much about, just because of the nature of sort of the legal framework around that, which means that we no longer have that oversight. So we sort of don't know the full extent of what, for those families having to move into temporary accommodation outside of the borough, may have had in terms of the vulnerabilities and the welfare concerns that family might be experiencing, which, you know, and as I said, it's not to say that we necessarily could do anything about it, but it's really helpful to have a sense of what does temporary accommodation, putting children into temporary accommodation, uprooting them from their context, moving them into another space that is maybe also too small, moving ethnic minority children into schools where there might be very few people who look, or you know, or who they can relate to. We've sort of lost that information when they go, and I know that we're endeavouring to keep those numbers very small, but it is something that I think is food for thought about whether there might be some way of being able to figure that out. Do we have any other questions from the Commission?
Just to comment, thank you, Chair. Just to comment on what you just said, I think also the change can be so abrupt. It can be very traumatic. So I really do support that in trying to find out what else can we do, or up until what point do we follow up, and we might not do it as a council, but could we think of that as well? Because there is this period where people have no support, and it can be extremely traumatic as well for children and young people.
Sure. Councillor Binny Lubbock, please.
Just a couple of quick questions. The looked after children that are in temporary accommodation, I'm trying to get my head around what that looks like. What's the kind of the setup there? And obviously we're there as the corporate parent, and what's the scenario in which how does that made to work? And then also, how temporary is temporary accommodation for these children, and what's the impact of the length of time that a child in temporary accommodation have on their general welfare and education?
Do we have any other questions? If not, I'll hand that.
So my question would be about students in year 11. Is there some sort of protection to those young people, especially so close to exams, when we're looking at rehousing them? Do you sort of ensure that they have the safeguards to ensure that they don't fall behind moving at that late stage in the education?
Apology, can you repeat that question?
It was a question around if there are any safeguards in place to support children who might be approaching their GCSEs, and presumably to sort of keep them in the borough, or to ensure that the disruption is as minimal as possible. So.
Okay, thank you. Thank you, Chair. So just going back on the previous points, I don't know if I said that when a child moves out of borough, there will be a child protection assessment carried out by that new local authority, and any existing plans that families are on will transfer over. There's no set time, councillor, of how long you follow up for or what follow-up is done. It's just making sure that once that child and family have moved, that the new local authority that they go to have all of the relevant information in terms of what we've done as a local authority. And it is quite frustrating or difficult for staff if the support that we offer isn't always readily available in the new borough. But inevitably, after a while, they will have to stop on that follow-up, because otherwise those staff will then find it challenging to be able to support all of those existing children. But they do follow up as much as they can. So in terms of children that are in care and corporate parented, it's where a child has been subject to an interim care order, but they may not agree with the court, has agreed with that child to remain at home. So these families may be in temporary accommodations while the court proceedings are being looked over. So it's not a case of that, they've just presented homeless, we don't know what's happening with them. There's been specific things around the court proceedings that have been happening. So there's been a temporary decision made of where they will be housed for a short period of time. And councillor, the length of time they'll stay in that will be on the nature of every individual case, but obviously it will be monitored and making sure that's places where they are as suitable as possible.
And then on Andy's point,
apologies, Chair. That was, I remember now. Oh my goodness, having a cold is deeply frustrated, Chair. Thank you for that helpful prompt. Safeguarding around temporary accommodation. Well, there's a few things.
Sorry, just in case you missed it, it was just around safeguards for children who are doing their GCSEs.
What I can say is that our temporary accommodation in Hackney is part of our council suite to roll out free Wi-Fi. And I know that with our new providers now, that is one of the prerequisites that we look for. So in the event of a young person going in exam time that stays in our temporary accommodation, they absolutely will have access to Wi-Fi, which is critical. Unfortunately, there is no way that I am or officers are able to guarantee that no young person will be placed outside of the borough during exam time. I think that, as I said to you, that children's social care and housing are working closely together. So they will talk about what's happening in that child's life and the time. And, because, for example, if they've only got a month left and they're taking exams, really everything should be done to try and ensure that family's life isn't disrupted. So as much as possible, I know that officers work together and share that information. I think the challenge is always around stock. And then because people may be aware, because the government brought in the legislation where they put a cap on what they will pay for housing in London, it makes it very, very difficult now to find accommodation, especially in Hackney and London, on the amount that the government now say they will pay for. And that's the challenge that we're faced with, and that isn't within the council's control to be able to change the price of property. So it's deeply frustrating. So everything that can be done is done in terms of sharing information, thinking about the length of time that you can wait possibly for a family to be moved, but ultimately where they're moved to, it's very difficult for the council to be able to predetermine that because of the housing prices.
Thank you very much for that. And also just thinking about, you know, multiple conversations that we've had around falling school rolls in the borough. And I imagine, you know, I've just only recently had a case that I was alerted to myself around a family of 4 children being moved outside of the borough to be placed in temporary accommodation. And I suppose it just goes to show why those contacts, not just presumably with children's social care, but also with education, why those links are really quite important.
Chair, just interject. So what I would say is that the numbers of year 11 are significantly low. So officers do really try hard to mitigate the disruption because, you know, in total there's 153 children that are in temporary accommodation, which is just over 5% of our total cohort. And within that, those that are in year 11 are significantly low. So fortunately, because they are lower numbers, officers worked really hard in those cases to really mitigate those disruptions. So although I'm talking about the challenges, I hope I can reassure you, because the numbers are significantly low, officers do their best to mitigate the risk around those children in year 11.
Thank you very much for that. I think we're going to move on now to the final question, which is around the scale, to outline the scale of children who go missing from care in Hackney and the associated safeguarding risks that children face when they go missing. Which I know has got quite a lot of publicity recently, so I think the scale of the challenge is becoming a bit more apparent to most people now. So over to you.
It is, Chair, and I'm trying to think how to word it. I think it's a good thing there is more awareness. It's awful that children are going missing, but I think it's a good thing that more people are aware and attuned to children being missing, and also the way it's reported, but I'll get into that a bit later. So from the 1st of the 4th, which is April 2022, up until the 10th of March this year, 98 looked after children were missing, and that's a total of 860 times. 76% of those children were aged between 16 and 17. So you normally find it's our younger children, our young teenage children that tend to go missing rather than very young children that go missing. 71% of those children, the episodes was missing 1 day or less. So I think that although you know, you don't want to hear that over 800 times a child or a young person has gone missing, of that they're not missing for long. The longest period though that a young person has gone missing was 96 days, and that child currently remains missing, and they're likely to be remanded once they are located, and you know, everything that can be done around that young person is being done. I think one of the challenges, Chair, is that even if a member of staff speaks to a young person that is missing, they cannot say that young person no longer missing. They still have to be recorded for missing. So sometimes staff will know where young people are that are missing, but because they cannot verify the address, it's counted as missing, which is fine. And that's for a number of reasons. The young person sometimes may not want the police to visit where their family or friends are, or they may not want a social worker to do the checks that they need to verify that they're safe. And that could be for a number of reasons. They could be staying with someone that we or the council rather has said, actually, for a period of time you should not be around this adult. The young person may be staying in that house that that adult may be staying. So these are the kind of challenges that staff face, but obviously the longer they stay missing, the longer they're at risk of being criminalised or in dangerous situations. So a number of things are put in place to mitigate that. I might pause there, Chair, and maybe more of what I want to say will be pulled out in questions. I'm just keen for Commission members to have questions rather than hear from me.
Thank you very much for that. From my own personal experience of working with young people, I remember working with a number of young people who had loads and loads of missing episodes on their record that was not really massively concerning for their social workers. Because sometimes these were cases where a young person was recorded as missing because they arrived back at their children's home an hour late, you know, and that meets the threshold for their foster carer having to call the police and say that they're not home, or supported accommodation where they're living or what have you. Do we know from those figures that we have who are of a concern to us? Who are the young people where there's a suspicion that they are, you know, in Ipswich running county lines, or they're being sexually exploited, or the ones who are sometimes going back to their families as well, or the ones that where there is less of a concern around? Are we able to, do we know that sort of detail around the 800 or so missing episodes that we're aware of?
So yes, so as well as the individual social workers, Diane, Jackie, having the information, myself and more recently the Mayor and the Chief Exec will have the information of every child who is missing, their age, their gender, the linked social worker, the reasons why they've been missing. So whether, for example, it's sexual exploitation, the length of time they've been meeting. So all of that data is collaborated. So, for example, I know that I was quite alarmed and horrified when I saw that a child that was example 5 was missing, but actually it's because of the way we recorded it. The reason why the 5-year-old was missing is that they were missing with their parent, if that makes sense. So we have a detailed data that we track all of the young people. Sometimes when it's high episodes, it's that child repeatedly missing. And you're right, Chair, as I alluded to at the beginning, the way that you record a missing episode sometimes is really unhelpful, because if they're late, it's recorded as missing. If you know where they are, but you can't get to the address, you have to record them as missing. And I just think that if there was more flexibility to record, not at the registered address, but known to be at such and such, I think that would be helpful in how we record the data. What I would say is that we have a panel called the Extra Familiar Risk Panel that does forensic work on looking at that data and attempts to disrupt our children's activities and really, you know, get around where we know they are, try and visit where they are, be around where they are, so, and try and really work them to encourage them to get back to it. And as you know, that Hackney was one of the leading local authorities to do the work with Dr. Carly Furman around extra familial risk and the, you know, contextual safeguarding and how we use all that intel, and that works really well. And there's also a multi-agency panel with police, schools, foster carers, all working together every time that young person goes missing, and it cascades a series of meetings, information sharing, data gathering, reanalyzing the data and being really forensic and quite detailed around that, you know. So it's you know, something that I would look at on a weekly basis. It's something that troubles me, but I'd rather be troubled and distressed about knowing those children and knowing that we're tracking and all the things that have been done every time those children in our care are missing. And on average, sometimes it could be maybe 3-4 children. I've never had a weekly list recently that's been presented to me that's had over 10 children missing. It's normally numbers that are under 10, but obviously any child that's missing is always a worrying concern. but feeling reassured that it's not lots of children that we are looking for, which means that work we can do can be really forensic and detailed. I'm going to pause there, Chair. Apologies, I think I maybe spoke too long on that point.
That's okay.
Just the 10 that you mentioned there, Councillor Bramwell, you said you never have more than 10 or 7 missing children. Does that number include the ones that you say that are sort of known, either to be safe, either with family or an hour late? Does that number include those numbers?
It does, but the children that are missing, it does vary, but it does include those.
Okay, I'm going to take a question from Councillor Sizer and then Councillor Tebbit-Deloff, and then I'm going to move on.
Yeah, it was thank you. Just a really quick one about how we're supporting the foster carers when they're facing that predicament, when they're going through the distress of not knowing where their child is. What do we do to support them?
And then can I take one other question from Councillor Tebbit-Deloff?
Yes, thank you, Chair. Thank you, Councillor Bramwell. Yes, it is reassuring that there is a multi-agency support for those children that got missing. A recent case I've been working on as well highlighted this, but I highlighted also the very same issue that you just described about data and recording of young people, children and young people that are missing, but that are assumed to be with a relative and might not necessarily be with a relative. And the experience is very frustrating because it's almost like all support stops. Everything comes to a halt because there is an assumption that this young person is with a relative in a safe space when the relatives themselves know, no, they are not with me. So is there anything that, you talked about, it would be helpful to change how that is recorded? Can that materialize? Can we do something about it? Thank you.
So I'll start backwards. So government legislates how we record, and I would happily go into government just to change these things. And I'm sure many of us would want to see a change in government and how it's recording, but we continue to raise those issues. What I can reassure you is at a local level, we don't make assumptions that young people are with their families or friends. If we record in our data that they are with families and friends, it's because we've contacted them and we've been reassured and feel confident that the information that we've gathered from family and friends or relatives is sound enough for us to say we know that where that young person is. So be reassured of that. None of the forensic data that we look at is based on assumption. It's all factual finding and very dedicated officers working tirelessly to ensure all the data that we have is live, current, and accurate, because that is the best way that we can ensure that we're safeguarding our children as best as we can. In terms of supporting our foster carers, there is a designated foster carers out of our services that operates until 10 o'clock, but then after 10 o'clock they can talk to what's called the emergency duty team. We've also changed since August the way that you can be notified out of hours, and an email now it can be sent, and that so carers can now email what's called the children's rights officers, and there can be more thorough information through the children's rights officer throughout, and to give foster carers more reassurance. When a child is reported missing, they are in the police is in immediate contact with the foster carers, and then the foster carer can contact, as I said, the emergency duty officer, and then also the social worker or the children's rights officer will then follow up the next day with the foster carer, one, to find out if that child's returned, if they haven't returned, what will be the next state of play. The children's rights officer and police officers offer regular training for our foster carers around what they can do if a child goes missing what is the protocol, what's the procedure, helping them as well in terms of managing how they feel. You could imagine the weight of responsibility they feel when a child goes missing. It's sort of like when we look after our families or our friends' children, it's that added weight of responsibility that it's not your precious little person, so you take that care of always wanting to be able to hold them back. So there's lots of support around that. That service has got consistent good feedback from our foster carers in terms of the support that they've been given. It's also important that the foster carers are part of those discussions that I mentioned before around the child. There's no point talking to professionals talking to themselves and sharing all that forensic evidence and not speaking to the foster carers themselves, because ultimately they are the ones that are responsible for that child. So they are included in that meeting as well. And all foster carers have an allocated supervising social worker that works with them, and there are also support groups in that as well. I mentioned agencies. The ones that are involved depends on the child, but it's generally the police, those that have a children and family worker, parent and carer, foster carer, the schools, our youth offending team, Young Hackney, and our PAMS. So that's children and adult mental health services. That's generally the team, but it is also bespoke. So other agencies may be involved depending on the need of that young person or family, talking about that extra familiar risk, what I mentioned before. Thank you, Chair.
Thank you. I'm just going to take one last question from Councillor Billy Lubbock. I think it might be something that we haven't covered.
Yeah, just very briefly. I'm wondering how many, if any, unaccompanied asylum-seeking children go missing, and are there additional safeguards for that cohort?
Thank you. So in that period that I mentioned, 2 of them were children that were unaccompanied asylum seekers. One missing 4 times and 1 child that went missing once. One of the children was Albanian, and the reason that prompted their missing episode is that unfortunately they had a negative decision from the Home Office, which was really awful for them, and that was in relation to their application and the news that they would be deported. And obviously that really upset the young person, and they went missing. And you know, when a young person goes missing in a country that they're born and raised and have networks of communication in the same language, you're still very concerned. Overlay that with English maybe not as a first language, different culture, different setting, different conventions, different norms, the risk and concern of that child is heightened. So the things that we do is more around cultural competency, cultural awareness, making sure that we're not making assumptions around that young person, their lived experiences, and making sure that due diligence is around cultural competency around any young person that is unaccompanied and seeking asylum at any given time, counsellors. So those are the added trying to safeguarding procedures that we try to put in place to take care of those children, and also working with children and young people, especially, you know, so it's not that staff didn't try to prepare that young person for what might happen, but even still, even in the midst of those conversations, that young person still got very worried and very scared and went missing, which you can understand, right? I could imagine anyone having to go through a Home Office experience finding that really distressing. Thank you, Chair.
Thank you very much, Councillor Bramble, and thank you very much for your answers to your questions from the Commission this evening. I think we're going to move on now to the next items, which I'm hoping we might be able to get through, well, certainly in the next 3 anyway, fairly quickly. But yes, thanks again, and especially for joining us despite being unwell, and I do wish you a speedy recovery. Can I hand over to Martin in relation to items 6, 7 and 8, just for a brief update on what we're doing with those?
So I think 678 is really this is our last meeting here, just to give you some update around the anticipated outcomes which we expect from these pieces of work. So the unregistered educational settings, the letter which we've agreed to send to the DFE, which we've all had sight of now, and we'll publish that in the next agenda properly. So that's the letter which was sent to highlight the ongoing risks that our children face around unregistered educational settings, and the need to have additional legislation in place to make sure that those settings are brought within regulatory control. So we can publish that within the next one. So that's the outcome. So that we'll be publishing that as well. Our previous meeting, support for young parents, I'm hoping to have this done, actually, to be honest, but so we have developing the recommendations for this from those outcomes from that meeting. So it's assimilating our focus groups. We have the young people, and the report that we had with our public health, education, and children's social care contributors that, and that will go in a letter to Councillor Bramble, who's the oversight for that there, and we'll share that with our colleagues here to finalise those recommendations and all kind of piece as well. So I suspect we might want further input on those as well. So do you want to say anything else more about that, or you? No? Okay. And the ongoing one, which is a bigger piece of work here, which relates back to a while, is a much more detailed piece around what those recommendations are. It is a much more detailed piece of work, which will not be a letter, it'll be a more formalised report, which will need to go to Cabinet, because it's recommending policy changes. So that will be a bit more detailed. That is, again, the last stages, but we'll need to consult with our foster carers around what those final recommendations will look like once we circulate to yourselves as well. So this is mainly just a flag that, in terms of there's a public record that there will be outcomes from here. We can track back with the goals through.
Thank you very much for that, Martin. And then moving on to the last substantive item, really, which is item 9, which is the work programme. As Martin explained, this is the last meeting of the municipal year, so it's really an opportunity for us ahead of the more formal sort of consultation process, which will happen in a few weeks' time already.
So the start of each municipal year, we'll do a consultation on what we think is what issues are pertinent or kind of what's picked up on from. There's a formal consultation involving loads of stakeholders, ourselves, other non-exec members of the public, community, etc., HCBS. But this is the point where we, as a commission, reflect back on the year, really. What issues which have resonated with us, what has worked, how scrutiny has worked in terms of the process, how we collect data, how we do scrutiny, what's felt useful and beneficial to you as scrutiny members. So it's just a kind of an educational and learning kind of piece for us to always, at the end of that year, to kind of think about issues which have kind of resonated and worked, issues might want to take forward in rolling programme to next year, just so we have that kind of continuity in terms of moving over from the work programme from this year into next, and kind of make an opportunity for members to reflect what priorities to take forward to next year, which will inform that kind of work programming kind of process as well. So it's just a kind of an end of year kind of, to formally capture this in public around issues that we might want to kind of take forward, or again, it's more broader thing around. Every year we do this around, what issues have resonated with you, feel that you've got something out of as members, or other things which haven't worked so well as well. So it's just that order of reflection.
And so yes, on page 49, you can see what has been looked at over the past this municipal year, and then on page 59, you've got some of the possible items that have been noted that we can obviously look at 23, 24. So that's all those times we're in those meetings and we say we might come back to that thing. Martin quite helpfully does take note of that, and we find that they appear here at the end of the municipal year, ready for us to reflect on whether we want to do anything more about it. Steve Douglas first.
I just wanted to
So hungry.
Best topic will come.
I wondered if we could include in the list of possible items to consider this issue of the attendance and children not in school, emotionally based school avoidance, as we've heard tonight. We don't know even actually what the numbers are, but that those children are particularly vulnerable, and it affects not just the children, but the whole families. We've had Michael Gove recently stating that, you know, this is a national area of importance and threatening to cut families' benefits who have children who aren't attending. So I think it's a huge national issue, and I think it should be something we should be really looking at locally. We know it's an issue locally, but we don't really have enough detailed information or data or a sense. We know it's a problem, we're hearing that, but not with any sense of any strategic approach to dealing with it.
Sorry, so the suggestion I want to put forward as well is related to the emotional impact it had on young people, and it follows up it on the work on the school exclusions and this sort of this punity system which has heard, and the growing impact it has on young people, children and young people attending a school, the fears it causes, the trauma it causes. And I think that is now should be, I mean, it's a major issue at the moment nationally as well. That would be really good to see what's that impact.
I think that really intersects actually with the sort of the anxiety.
There are some ramifications, aren't there?
Yeah,
absolutely.
Anybody? I think Andy, you want
Yeah, I
to.
just had a couple really. One was around we talked about mobility. There's falling role in the system at the moment, and as a result, there's a high rate of mobility between schools. Certainly would like to know the impact of that on school roles, the local authority, and on outcomes as well. And I know at previous meeting you talked about ARPs, and I know we discussed ARPs within the primary sector, but there wasn't any in the secondary sector. Just wanted to know, you know, has that moved on? Because I think there were 3. Primary or 4, but there's only 1 or multiple in the secondary sector. The question is, where do they transition to, particularly the primary ARP sector? So those are the things I'd like to pursue.
Interestingly, just thinking about the next meeting for the commission, which is in June, it will be helpful for us to have a think about what that might, because the whole commission might be made up of different people, so it might be very helpful for us to sort of set out what we think should be looked at that stage. Now, what will be coming to the commission anyway would be childcare and place planning. These are standing items that would come to the commission anyway, and also school admissions. But maybe on that point that you mentioned, Andy, actually it could come in around school estates, because that's a very topical issue at the moment in terms of the proposed the consultation that's gone out in relation to school closures in the borough, because that's, you know, I think that the ARPs have been put in places where there's capacity, so the school estate, the strategy in the most part should be able to incorporate a conversation around the development of ARPs. And actually it's quite a time, it would be quite helpful to focus the school estate conversation on secondary schools, because at the moment it's very much focused on primary schools, but this is going to translate into a challenge for secondary schools for sure. So so I don't know what people think about that maybe being on the agenda for the meeting for June. And are there any other?
Yeah, just some observations. I thought it was, you know, everything I found was really interesting and helpful being new to the commission. I particularly found the session on child food poverty really enlightening, and I thought it would be interesting maybe if we review some of the impact of the Mayor of London's free school meals and how that's kind of rolled out. The attainment gap data I thought was really interesting, and hearing the experience of foster carers was really powerful and important. And obviously there's a lot of follow-up, and we're talking about how we follow up with that and previous recommendations. Just looking at the other things that were on the list, potentially, I think, as I say, the impact of school closures more broadly, as well as what's happening with the estates, is important. The family hubs, we still need to see that plan and scrutinise it, and I think that's going to be really important. The other two things that are kind of in development there that I think are also really big and kind of overlap with a lot of the other work we're doing are the youth justice plan and the PRU redevelopment. And then something that's not on the list that I was wondering if there's space for it would be the LGBTQI plus experience of young, especially trans and binary young people, and the services that they receive and support they receive from Hackney.
And helpfully on that point, actually, we did a piece of work on that a number of years ago that I think we could quite helpfully sort of look at, okay, well, where do we feel that we are now based on that.
I think what feeds into that issue as well is to what extent, what are the services for young people experiencing gender dysphoria, particularly in relation to the Tavistock Gibbs Clinic closure. And we know that that's a growing cohort.
And more broadly, gender non-conformity and all those issues that surround it.
Linking back round, and again, to potentially hear from the services that are providing mental health support specifically to the community, and to find out a bit more about if there is a feeling that there is more that can be done, whether it's at the school level or at the local authority level, to be a more inclusive and embracing sort of community for them to grow up in. Councillor Sizer and then Councillor Gordon.
Yeah, loads of really good suggestions, but as always, I just wanted to suggest that there would be a focus on fetal alcohol spectrum disorder. It was interesting when we had the original meeting with CAMHS that actually that was something that they were saying was missing in terms of the stats, and therefore if it's missing in terms of the stats, in terms of the support that's available, generally the focus within the borough still seems to be to be on autism, which is right. But if we know that fetal alcohol is more common than autism, it would be really positive as a borough to be focusing again on that. And I mean, I just feel like there's a lack of knowledge about how common it is within the borough. And if we could start with that, we could then look at what support structures are needed and in place. And it was good that CAMHS seemed to reinforce that as well when we had the meeting with them.
Thank you, Sizer. We'll have an opportunity to do as the week go on. Obviously, who's in the depending on who's in the hopefully it'll be many of you here will be able to come together and reflect on some of the insights that you've shared today, and to think about which of these items would warrant a sort of deeper, more in-depth review. But as you will have seen from this year, it doesn't have to be a review. It can just be like the item today, where you have a couple of site visits, and it really, and focus groups, and it hugely sort of furnishes your understanding of the challenges in a way that you could just never do in the sort of course of a meeting. So and fetal alcohol syndrome might be one of them, because I think it perhaps when we did look at it, perhaps didn't yield the sort of richness of information that we perhaps hoped in that session, which maybe suggests that perhaps we could look at it outside of the meeting setting, and maybe that might, But Councillor Gordon.
Sorry, Chair, really briefly. Yeah, I mean, we've obviously been discussing for a while, I think, the possibility of looking at behaviour management policies. I mean, that's obviously was one of, I think, the community priorities arising out of the work that we've done on child Q. And obviously, Councillor Telford-Delloff has touched on that a bit, I think, in what she was saying earlier. But I think there is, I think there is really scope for just a more holistic look at sort of behaviour management policies, and the sort of the evidence base for them, the sort of impact and sort of the disparities really. So
it feels like it's great. If you just reflect on the meeting that we had today, there's clearly people with a lot of experience in managing the behaviour of children who have potentially additional needs have quite a lot to say on it, and let's hear that. Let's have a look at what best practice around behaviour policies actually look like.
That would be brilliant. Sorry, that would be brilliant. I mean, we have heard cases of young people having panic attacks, or thought of having, forgotten something to bring to school, or not wearing the right socks, or
Exam stress.
not being able to go to the toilet when it's not the noise and adequate break time. This is really concerning. The amount of stress and anxiety that is creating in young people and all students in schools.
So this isn't the end of this conversation. So beyond this meeting, we can continue to have this conversation, and if there's things that come up for you that you would like to see included, and then the process that we go through thereafter is about trying to, because annoyingly we don't ever have enough time or enough places in the work program to look at everything, and there is a challenge which I have to say I'm not always necessarily good at rising to, of trying to do too much and not going into enough depth in it because you're doing too much, and it's about that sort of balancing act which we will embark upon in the next couple of weeks, trying to figure out what the year will look like. So yeah, let's keep that conversation going, and we'll be hearing from others on it also as part of the consultation process. So sorry, there are just, so then we've got item 10, which is the minutes. The minutes of the last meeting held on the 20th of March are attached to page 63 of the report pack. I don't know if there are any matters, are there? No. Members approve the minutes?
Yes.
Great. Item 11, next meeting, any other business, the next meeting is the 27th of June. Thank you so much.
Thank you.
Got a bit of a break.
Yeah.